Sorry, guys, I'm just trying to connect all these technical issues. Can you guys hear me?
Yes.
Yes.
Okay, good. Thank you. Sorry about all the craziness. I'm not a tech person, so I should have got one of you guys to help me with the tech part of this business. Let's see. We're about to go live on Facebook, okay? Okay, good morning, everyone. Thank you guys for coming and joining us. I am so pleased that you guys have been able to make it. So I am going to share a PowerPoint. So all of you that are watching on Facebook, please share so your family members can join us. I'm going to go back and forth between English and Wolof. So I think we have some attendance. So everyone that's watching on Facebook, please join the Zoom call if you have any questions, and then we would go from there. I'll give you guys a few minutes so you can share with the rest of the. Some people asking for this. Just give me a few minutes, please. Okay, great. Let's see. Sorry, I'm admitting people in the waiting room, so.
Hey, I'm good. What about you? I say about you. Good. Yeah, I was opening to make a little.
Okay, everyone, so I guess we would go ahead and start.
If you can
I
close,
created a PowerPoint. I tried to share the PowerPoint with you all, but then we have a little bit of difficulty. If everyone can go ahead and mute, please. So we are about to start. So if everyone can go ahead and mute, please.
She's doing good. She's not eating a lot of her breakfast, but I was let her take
So like I
nap,
said
maybe.
earlier, we would be going back and forth between Wolof and I guess there's more people. Let's see. Someone.
Yes.
I will be right back. That's I have it. Not sure who that is. Sorry, guys, I'm trying to maneuver between the messages.
Dr. J, you can mute everyone from your end since you're the host.
Okay.
Yeah, and then you could just take it from
there. Can
you
switch back the host so that way you can let people in because it's distracting me?
Let me try.
Yeah. Thank you.
I can't, so you may have to do that from your end.
Okay.
Make me the host again, and then I could help you control.
Okay.
Go to the movies with me. Go like that.
Are you there, Juka?
Yes.
Okay. Are you the host now?
Yes, please.
For some reason, there is a feedback that's coming in late. Okay, thank you all for your patience. Thank you all for your patience. We will be recording this webinar as we discussed. So we're about to start. There's a little bit of a feedback that's coming back and forth. So if you see me pausing, that's the reason. I think it's all about technical issues. So thank you all for being here again. And once again, please share and let your family members know. We are here today to talk about diabetes and reversing diabetes. So before we start the program, I just want to thank you all for being here. But I also have a little bit of a sad news, which I would love to share with you. And it's all related to diabetes again. Early this morning, I was waken up by my mom and notified that one of my uncles just passed away. And this is a guy that is really, really close to me. And I almost canceled the program, but I did not want to disappoint people. And I feel like this is one thing that I probably should have continued to do, because I've never known him being sick. But when I called to just see if it was true that he passed away, the person that answered the phone told me he's still in the hospital in Senegal, in Dakar, and he died from diabetes. So it's very emotional right now. So you guys please pray for him, and pray for everyone that has passed recently, and every single person that dies from diabetes every single day. At least about 1.5 million people die from diabetes every single day. And it's very weird because I feel like there was something that's telling me, because I love to teach, I love to educate people about diabetes and everything else for that matter. But for some reason, for the last couple of months, I've been emotionally connected with this disease, not knowing the day that I'm going to have my first webinar, I'm going to lose someone that is so dear to me and close to me. So I'm a little bit emotional. Forgive me for that. We are all human. But this is a calling for sure, because this is going to tell me for sure that I have to continue on this journey, to continue to educate people and the community about this disease. Because like you all know, 1 in every 4 people may have diabetes and not even know it. And I think this was a perfect example that he never told me, he never knew he was diabetic. I think this will be the first time that he found out when he's already gone, and that is very late. So the reason why people don't know about diabetes most of the time when they're even not diagnosed yet, I think when we talk about the disease, you guys will know. Most of the time, diabetes is nothing but resistance to carbohydrates, which is sugars. So when you're born, you start eating all these foods that are high in carbohydrates, and then your blood sugar continues to rise. Over the years, it accumulates in your bloodstream. And as time goes on, it becomes difficult for your system to even metabolize this sugar. So like you guys all listened to my previous videos that I talked about diabetes and how it happens, and what happens in the system or in our body is that you have 2 main problems with diabetes, especially type 1 diabetes. Type 1 diabetes, usually there is no insulin production because there is some kind of a problem that happens to the pancreas with the beta cells, and then your body just refuses to produce insulin. So therefore you continue to accumulate sugar, and then that puts you in a stage called hyperglycemia, meaning too much insulin that you cannot even deal with. Well, the main problem that we have with the type 2 diabetes is not that you don't produce insulin, it's the opposite. You produce too much insulin. And why do you produce too much insulin? The reason why you produce insulin is that every time you eat anything that has carbohydrates, meaning bread, rice, potato, pasta, all of that has some carbohydrates, including fruits and vegetables. So you continue to consume these foods at a high level, and then your body becomes real sensitive to those foods, because every time you eat anything sweet, your body gets in a hyperactive state and said, well, this person is killing themselves. I need to produce a lot more insulin available all the time for this individual, which puts you in a stage of insulin resistance. Meaning you have insulin, but it will not be able to open the doors for the cells so the cells can receive the sugar. So what happens over time is that this person will end up being hyperglycemic and still have high insulin level. So why is it that some people may find out early and some people may find out later, or some people may not even find out and end up being like my uncle? is the fact that you have high insulin level that can cause a lot of damage before the doctors can even detect that you have diabetes. So it is important to know what are the key things that you need to look out for, like symptoms, before you know that you have diabetes. If you look at people that are obese around their neck area, you will see that they have this leathery looking skin. And that's what causes them for you to be aware and saying, okay, wait a minute, around my armpits, around my pubic area, my groin, the back of my neck, even the back of your fingers may be dark. Or you may just end up gaining weight real rapidly and have no idea why. You may get real irritable or hungry. And sometimes some people may have no symptoms, but just a little bit of tingling around their fingers and their feet. And the reason why is the fact that the body is always trying to protect people. Whenever your body needs more energy around your heart, around your vital organs, guess what? It shunts everything that is bad to the most distal part of your body. And that is why most people will have numbness and tingling on their feet and their hands before they even know that they have diabetes. So I'll just translate this a little bit in Wolof so people that are here that cannot speak English can understand. Mbokk yi li ma jot a wax fii mooy ne feebari jabet lañ bugg a waxtaanee. Fan yi yëpp nag maa ngi continuer di wax si mbiri jabet waaye ndeke xaw ma woon sax lu tax ma continuer woon di wax si mbiri jabet waaye xëj na suñ borom bi am na lu ma bëggoon a wax loo xam ne bàyyiwuma si xel. Mooy ne am na kenn koo xam ne ku ma jege la nekkoon suma oncle muy suma nijaay koo xam ne musuñ koo wax ne dafa am jabet musta yëg ne dafa am jabet tey si fajar si ma jot xibaar ne faatu na Dakar ngir jabet. Ndekete boobu yàlla mu ma doon wax ne continuer di def liggéey bi pour yéebaane yëgal nit ñi li nga xam ne mooy feebari jabet nga xam ne ñu si bari dinañ ko dund ak moom te duñ ko xam. Ndik jabet li muy rey si doomu aadama bés bu jot dina dem si 1,5 million si àddina si. Ñeenti nit ñoo konte am na kenn koo xam ne am na jabet te yëgu ko. Kon dafa mel ni suma nijaay si ñeenti nit ñooñu la bokk moom kenn kooku boo doon konte ñeenti nit ñi si la bokk. Kon jabet ñaari mbir moo koy am benn bi mooy ne amoo insuline wala insuline bi nga am jëriñut la dara. Biñ si gën a gis nag muy gën di lor nit ñi mooy insuline bi nga xam ne du jëriñ nit ñi dara dinañ am insuline. Kon léegi dafa am solo pour nit ñi mun a gaaw a ràññee ne dañ am jabet nu ñuy gaaw a ràññee ne dañ am jabet balaa ñuy yëg sax ne dañ am jabet wala balaa docteur dinañ wax ne dañ am jabet mooy ñaareel dinañ gis seen deri yaram yi féetoo si seen dox ak seen poxataan. Ñi nga gis ne seeni borom dañuy am deri yaram bi dafay dal di ñuul mel ni deri mbët wala ñu toog seen tànk yi ak seen loxo yi di lu ñuy wax numbness ak tingling mel ni dafa am ay pusa yu la ñuy jam te fekk na borom yëgagut ne dafa am jabet fekk na borom lu tax loolu di xew mooy ne li ñuy wax insuline hormone boobu mooy dal di bari seen yaram ba nga xam ne dafay def loraange lu bari moo tax seeni borom dañuy gaaw a am feebari xol wala feebari tension. So I was just telling everyone in English, in Wolof, what I just said in English earlier. So just bear with me because we have two separate communities because as you all know, I'm African, but I'm also American. So I want to help both of my communities and it sometimes makes it a little bit difficult for me to spread myself, but I think we can all deal with it today. For the sake of humanity, we can all have the patience to just know what affects one person in one continent affects the other person in the other continent. So now we just talked about the diabetes, the earliest warning signs, which are the leathery skin, the numbness and tingling, and the infections of yeast infections, recurrent yeast infections, especially with us females. If you keep having yeast infections and have no idea, please go to your doctor and check for your blood sugar or even abscesses. So why do you always have these problems? The reason why you have these problems, because number one, your pH level has changed, but also everyone loves sugar. And the sugar level in your blood is so high, but it's not detected yet. Because most of the time when we test for diabetes, we only screen for diabetes, meaning when you come for a yearly exam, we check your blood sugar level at a fasting stage. And when we check your blood sugar level, and according to the Diabetic Association, if your sugar level is less than 100, then you are fine. Well, based on my experience and research that I've done over the years, that is not the case, because when your sugar level is above 100, you've already been into pre-diabetic stage. And once you're already in pre-diabetic stage, you've already encountered a lot of damages. So the most accurate blood test to actually let us know if we're diabetic or not is if you check the person's hemoglobin A1c. So what is a hemoglobin A1c? Hemoglobin A1c is nothing but you have hemoglobin, which is your blood. If you know what the blood cells are, you have hemoglobin, that's part of the blood. So over time, when your blood sugar is so high, the amount of sugar in your blood will attach to the hemoglobin part of the blood to try to help itself. So when we check for hemoglobin A1c, that's what we're checking for. We check for hemoglobin A1c to see the percentage of glucose that is attached to the hemoglobin. Now, why do we wait every 3 months? Well, we wait every 3 months because the blood cells last about 3 to 4 months, and then it will die and regenerate itself again. So that's why we check for 3 months, because then you check for over the past 3 months, how much glucose has been attached to this hemoglobin, and that's what gives you the hemoglobin A1c. So I would say if you have some symptoms, or you just had rapid weight gain, or you are just curious, you should ask your doctor to check your hemoglobin A1c. So li ma wax foofu mbokk yi mooy sànq ne li nga xam ne moom la doom aadama yi jëkk a war di bàyyi xel buñ xamagutee ne dañ am jabet mooy dox gi nga xam ne dafa soppeeku nekk ñuul kuk mel ni dari mbëtt, ki nga xam ne dafay am feebar yi lu ñuy wax yeast infection, mooy mbokki jigéen ñi dañ koy faral di am ñuy wokkatu, wala ñu am li nga xam ne mooy taab. Léegi nag lu tax mu am solo pour ñu xam suñ deret suñ suukari deret fan la tollu, jafe-jafe bi mooy ne suukari deret balaa mu lay wax ne da nga am jabet dafa fekk sa suukari jabet dem na ba ëpp lu mu téeméer. waaye bu eggee téeméer dafa fekk dañ la naan yaa ngi pre-diabetes, maanaam yaa ngi waaja am diabetes. Léegi nag am na benn test boo xam ne ñëpp war nañ di ko laaj seen docteur pour ñu seetal lañ ko, même bu leen ni dañ ko war a fay ndik cherut noonu, mooy lu ñuy wax hemoglobin A1c. loolu lu ko waral mooy ne suukar si dafay tayu si benn fànn deret ji, te deret jooju dafay dund lu mu 3 weer ba 4 weer dal di faatu. moo tax toujours ñu koy seet 3 weer yu nekk. So now, when you all know that this is what diabetes is, this is what hemoglobin A1c is, these are the symptoms to look out for. There is more symptoms that you can look out for when you are actually diagnosed with diabetes, that you have hyperglycemia, meaning your blood sugar is too high, sometimes even 200, sometimes 300. And the problem with type 2 diabetes is that the blood sugar accumulates slowly over time and you will not even know, because your body will readjust to itself to try to fix the problem. So by the time you find out, you may end up going to the hospital and your blood sugar is almost over 1,000 or 2,000. And by then you go into what is called diabetic ketoacidosis. So when your blood sugar is high, this person can become very irritable, very hungry. They will continue to pee and pee and pee, keep drinking water, and they don't have enough water. And all they will crave for will be sodas and sweet drinks. Because guess what? You are now addicted to sugar. When you are addicted to any drug, if you're addicted to heroin, cocaine, you have almost similar symptoms. You get real jittery, you get real anxious, your heart rate goes up because your blood sugar is high. So now when this person starves themselves of sugar, what happens? They start shaking, they start getting hypoglycemic. Hypoglycemia meaning they're going to start sweating, they're going to start getting irritable, they're also going to be very lethargic, fatigue, and sometimes even confused. So when you're with someone that is diabetic and they're talking nonsense, don't just think that the person is crazy or they're just acting crazy or they're difficult to deal with. Possibly that person has what we call hypoglycemia, and then eventually that person may end up passing out. So later on, we'll tell you what are the things that you can do to help the person to not get into this stage where they are going to end up being hypoglycemia or go into diabetic coma. So there are two types. One, you either have it too high and now you are into diabetic coma, or your blood sugar is too low and now you have a problem to deal with it. So what I tell people, I would rather have your blood sugar too high than too low, because when your blood sugar is too low, you pass out and you may end up dying without anyone being able to bring you back to life. So it is very important for us to educate ourselves on these two signs and symptoms. And then I would stop the discussion here and allow people to ask questions. And for those of you that are on Facebook Live, you can post your questions and Juka will relay those questions to me. And those of you that are on the Zoom call, you can unmute and ask your questions. Or if you have friends that are sending you questions, you may also ask those questions as well. Thank you.
Does anyone have any corrections? Good morning, everyone. If you have any correction, please feel free.
Si ñi nga xam ne ñooy làkk olof képp koo xam ne am na loo bëgg a laajte rek mun ngaa unmute.
Allo, salaam alaikum.
Wa alaikum salam.
Dr. Jainada.
Alhamdulillah, Binet, thank you.
Ça va bien, waaw. First of all, my condolences. Ñu ngi lay jaale sa nijaay boobu, yal na ko Yàlla yërëm te xare ko aljana. Thank you so much for what you're doing today. It's very important for us, especially a person like me who loves sugar. So almost everything we're buying now has sugar. How can we help ourselves? What kind of food, especially in the morning when you wake up after sleeping for 8 hours, what do you think we should discipline ourselves to eat every single day to avoid a lot of sugar in our bodies? Thank you.
Thank you. Thank you, Sister Binet. Li Sister Binet laajte foofu mooy ne naka la ñuy def ba nga xam ne ñun ñëpp dinañ fagaru ndik fi mu nekk gis nañ ne nit ñuy lekk suukar bari na torop, naka la ñuy def ba moytandiku suukar bi. Dinaa ko tontu si angale bi ko faram-fàcce ko si kàllaama wolof pour dimbale suñ mbokki déglukat yi. Sister Binet, that's a very important question to ask because, like you said, every food that is out there has sugar. And this is very difficult for most people. Most people really want to do the right thing, but they have a problem in terms of how to eat and what to eat. So usually when people wake up in the morning in Africa or in the West, all they want to do is eat breakfast. And breakfast usually contains high sugar levels, whether it's fruits or it's carbohydrates, you name it. So what are the things that usually have high content of sugar? It's usually your starchy foods. And all foods are not created equal in terms of the sugar or the type of sugar. So when you consume stuff like flour, processed flour, like bread, just plain bread, processed oatmeal, pasta, all of these have real high concentration of sugar. Now, if you want to be healthy and you want to avoid a high sugar level, we tell you, well, you need to eat more brown rice and brown bread. Yes, these are okay, but the only difference between the browns and the white is not much, especially the processed one. If you look at brown rice and white rice, the difference between the two is just the glycemic index. So the higher the glycemic index, the more sugar that is in that rice, but it's also the difference how that sugar will react in your body when you eat it. When something has a high glycemic index, the minute you eat it, it's going to make your blood sugar level go up. So the difference between that and the brown rice is that when the glycemic index is low, it takes a little bit of time for your body to adjust and allow that sugar to be used within your system, and it will not spike your blood sugar real high. So what would you do if you were to avoid, or if you want to avoid being diabetic, or if you're already diabetic and you don't want to be diabetic forever, you want to reverse diabetes, because that's the main purpose of this program. If you're already healthy, you don't have diabetes, you don't have any of these symptoms, you've checked your hemoglobin A1c and it's below 5.1, because I would say a hemoglobin A1c less than 5.3 is great. But how do you do that? How do you maintain that? Number one, you do not want to go according to the American Diabetic Association, which tells you you have to eat at least 40 to 60% of carbohydrates. My rule of thumb is you should not consume more than 1 carbohydrate with high glycemic index a day. So if you're going to eat breakfast and you love your croissant, especially my French-speaking countries, or you love donuts, then you want to make sure you only eat 1 donut that day, and you are not going to consume anything else that is going to raise your blood sugar, including rice, pasta, potatoes, bread, you name it, fruits, even fruits, or except the fruits that are low in glycemic index, like avocados, berries, the blueberries for that matter. Everything else, you need to let it go that day. So you have to choose, what would I want to eat today? Am I craving for donuts? Am I craving for rice? Am I craving for pasta? Now, how much of this should you consume? I wish I could share my PowerPoint. What I tell people is, if you're not diabetic and you're not pre-diabetic, make sure you divide your plate into 4 portions. And only 1 portion, 1/4 of that plate should be the carbohydrate, meaning the starchy foods like your pasta, potato, donuts, whatever. And that is just 1 time a day. That's what you should eat. So li ma wax foofu sànq mooy ne sister bi ne daf doon laajte ki nga xam ne dafa am buguta am diabète lan la war a dundee ba éviter boppam wala mu bañ a am diabète. Li mu war a def mooy ne ni mu war a dundee dafa am solo. Ndik lu tax lekk yi mu uute si wàllum suukar mooy ne li ñuy wax glycemic index. Li nga xam ne boo ko lekkee mooy tax sa suukar bi eeg si teew mi teew mooy lekk yu mel ni lekk yi nga xam ne dafa weex, lu mel ni ceeb, lu mel ni mburu, lu mel ni pasta. loolu lu mu utalee rekk yi nga xam ne dafa mel ni wàllum dugub, li nga xam ne dafa maroo mooy lu brown. luñ utale rek mooy seen glycemic index bi, mooy li nga xam ne dafa marron wala dafa brown, comme brown rice boo ko lekkee dina jël time pour suukar si eeg si sa yaram wi. Loolu rek moo lañ utale, waaye du ne du indi suukar. Ñaar ñi ñëpp dañuy indi suukar. Léegi nag boo buggee bañ a am jabet, li ngay def mooy ne bu dee amaguloo jabet nga bañ a am jabet, mooy ne dangay fexe lépp lekk loo xam ne dafay yéegal sa suukar, muy ceeb, muy findi, muy dugub, muy mboq, muy fruit, dangay fexe benn yoon rek nga koy lekk si bés bi. te boo koy lekk sa palaat nu mu war a toll mooy ne dangay xaaj palaat bi 4 xaaj. benn xaaj bi rek moo war a nekk si lekk yooyu. genn wàlle xaaj bi yëpp dafa war a nekk ay légumes, mooy vegetables. beneen xaaj bi dafay nekk protéine. kon ñaari xaaj yi légume lay doon, benn xaaj bi protéine, benn xaaj bi mooy doon maalo wala muy ceeb wala muy mburu. te loolu benn yoon bi rek nga koy lekk si fan bi si bés bi comme tey boo namoon mburu kon tey yëpp mburu rek ngay lekk benn yoon si bés bi mooy su dee danga ko bugg a añee nga añee ko boo ko buggee reeree nga reeree ko boo ko bugg a ndékkee nga ndékkee ko waaye munoo koo añee reeree ko ndékkee ko wala nga añee reeree ko même ceeb bi noonu la waaye ki nga xam ne nag dafa xas ba am jabet wala dañ ko ne dangay waaj a am jabet kooku li mu war a def mooy ne lépp loo xam ne dafay yokk suukaram daf koy bàyyi. So right now I'm about to talk about reversing diabetes. How do you reverse diabetes and how long will it take for you to reverse diabetes? If you are pre-diabetic or if you already have symptoms and not diagnosed, or if you're already diagnosed, even if your hemoglobin A1c is 13 or 18. Because I have patients that their hemoglobin A1c when I had them was 18 or more, which is really deadly. Because a hemoglobin A1c of about 100 puts you, or 105 puts you in a pre-diabetic mode because you're now at 5.7, close to 5.3 is about 100 or less. So when you start going into 120, now you're about 120 and more, then your hemoglobin A1c is now about a 7 or so. So these people that want to reverse their diabetes, it will take time because it took time, remember, over the years for you to get here. So it will take time to reverse it. And the other thing is, it takes about 3 to 4 months for the red blood, for the blood cells, the hemoglobin to regenerate, or the blood cells to regenerate. So if we are monitoring your blood sugar, it will take you maybe 6 to 9 months for us to reverse the diabetes, meaning you cannot eat or consume any food except protein, fat, and veggies. And the veggies, the darker, the better. Including soda would be not your friend. Bread, rice, potato, pasta, broth, whether it's brown rice, yellow rice, it does not matter. As long as it has a glycemic index greater than 20, you cannot touch it. That includes fruits as well. But it's doable. So if you just think about the consequences that you're going to live with, that will help you to decide to not consume these foods for at least a year or 9 months or 6 months, depending on how bad your blood sugar was. So li ma wax foofu sànq mooy ñi nga xam ne dañ bugg a dellu ginnaaw bañ a am jabet mooy ne seeni borom foog ñu am patience maanaam patience xam ne dina leen jël juróom-benni weer ba juróom-ñeenti weer pour ñu dellu ginnaaw si li nga xam ne mooy jabet waaye loolu foog ñu éviter bàyyi lépp loo xam ne rek dafay jur suukar muy ceeb muy mboq muy dugub lu munti doon borom lu muy dundee rek mooy ndawal li am graisse ak lii ay légumes yi nga xam ne du am suukar mboq bokk si pomme de terre bokk si muy potatoes. So I hope ne Sister Binet loolu dina leer ñu si bari dinañ si am jàng dinaa bàyyi ñeneen ñi nga xam ne bugg nañoo laajte waaye loolu dafa nekkoon the main topic of this program was how to reverse the disease, and I think it will be very important for me to talk more about it. If you guys have any more questions, please feel free. Thank you.
Anyone has any questions, feel free to ask away. You may be helping other people as well by asking those important questions.
Absolutely.
If no one has any question yet, I just wanted to ask Dr. J with back to Bennett's point. So what would you say would be the ideal breakfast if somebody wakes up practically? What would be the ideal breakfast? If no one has any question.
Thank you, Juka, for that question. So if people wake up in the morning, usually for you, those that are diabetic, if you're checking your blood sugar, don't expect your blood sugar to be low, because naturally when you wake up in the morning, God already has plans for you that you're supposed to be active, you're supposed to be productive. So your blood sugar will usually be high. So no one should just wake up and look for something to eat, even though they told you that breakfast is the most important meal of the day. Absolutely, it is the most important meal of the day. Because what does it mean to say breakfast? Breakfast means breaking your fast. Well, you fast whole night and you wake up in the morning and you want to eat, you're breaking your fast. Well, why is it the most important meal of the day? If you go for a whole day, the next 2 days and not eat, you haven't broken your fast. So that's why it's the most important meal of the day. But who is it to tell you when that breakfast is supposed to be? Every individual should have a different time set for their breakfast. You can skip breakfast and eat it at noon. They call it brunch, but it's still breakfast because you're breaking your fast. So what should you eat at that time? The best thing to eat at that time would be food that is high in protein, because then it can keep you for a long time. Let's say if you decide to not eat breakfast at 10, but at 11, you wake up in the morning, you should try to, you can eat yogurt. If you're not diabetic, you can eat full fat yogurt, not the low fat yogurt, because the full fat yogurt has less. If you love sugar and you want to have your sugar and you don't want to avoid the sugar and you're not diabetic, you can do yogurt and put some fruits in it like berries. Or you can eat oatmeal, which has a lower glycemic index, and it keeps you full and it keeps your fiber content high. You can do oatmeal, but oatmeal should not be the processed oatmeal. It should be the old-fashioned oatmeal for you, those of you that live in the US. Or you can also eat eggs. Eggs is the best breakfast that you can make yourself, especially an omelet. You can put mushrooms, which has a lot of benefits, which we will talk about later in another episode of this type of program in another webinar, the types of food that have benefits and what you can benefit from it. So let's say you have an omelet that has a real low carbohydrate, has a high protein content, and it has a lot of nutrition that will benefit you. So let's say if you were diabetic or pre-diabetic and I want to reverse it, omelet would be the best breakfast you can have for yourself. And you can put meat in it. You can even get up with a chicken tenders without the bread, or you can grill chicken and eat that for breakfast. There is nothing called breakfast food. The food that you eat should be of your choice, and the food that you eat should be able to treat you and prevent you from getting ill, because that's the whole purpose of eating. So lima tontu fofu jukka daf don laajte ki nga xamne dafa bëgg ndékki, ki nga xamne dafa bëgg ndékki te amul jabet, amul jegewul jabet, kooku mun naa lekk lu mel ni yogurt, waaye yogurt bi bu am low fat yogurt, na nekk full fat yogurt, mun na see def berries. Boobu benn la. Wala mun naa lekk li nga xam ne mooy oatmeal, lu xala mel ni fonde bu dugub, not bu mboq. Ndig boobu dina nangu sa yaram wi jël temps balaa suukar si di éeg si sa yaram wi. Beneen bi nga xam ne moo gën a baax sax pour ndekki mooy omelette, muy nen. Mun nga koo baxal, mun nga koo togg, noo ko munti toggee rek baax na. Xanaa nga fexe moytu diwlin gu bari gi nga xam ne mooy diw yi ñuy wax comme diwi gerte wala diw goo xam ne dafa jógee si ay légumes. Kon ki nga xam ne nag moom dafa am jabet, bugg a bàyyi jabetam, comme moom dafa war a éviter fonde, dafa war a éviter li nga xam ne mooy yogurt, waaye kon li muy ndekkee mooy nen ak li nga xam ne mooy ay ndawal wala ay ginaar mun na koo ndekkee. Te sànq li ma wax foofu dañ ne ndekki dafa am solo si dundi doom aadama, akañ dafa am solo ndig lim firnde si kàllaama nasaraan si mooy ne ndekki mooy ne nga dog sa koor. Te koor nag ko dogut kon yaakaar naa faatu moo si tegu, kon dafay am solo pour ñuy ndekki, waaye ndekki bi nag aju wut ne boo eewoo suba rek li nga war a njëkk a def mooy ndekki. Ndig doom aadama bu eewoo rek sukaram dina yéeg goo xam ne soxlawul pour ndekki, dina dem ba journée bi yëpp wala bés bi yëpp te du soxla pour mu lekk. Kon li dafa nekk loo xam ne war nañ koo bàyyi xel bu baax. Kon jërëjëf, thank you Jukka for that question. If you guys have any more, please.
Salam alaikum. Dr. J. Mariam, wow.
Mariam, thank you.
I have one question. C'est diabète ou xale yi en fait. Hein? Lan lañ mëna def pour éviter xale yi ñu am yenn diabète yi. Est-ce que ci alimentation bi la wala naka lañ mëna def daal lan mooy meilleure façon bi ñu leen mëna joxe lekk pour ñu bañ a am diabète. Merci.
Thank you, Sister Mariam. What Sister Mariam just asked there is, what about the kids that have diabetes? What can we do to help them so they don't become diabetic? So back in the days with diabetes, it was mainly type 1 diabetes was the only diabetes that usually affects kids. But because the reason why these kids have diabetes, sometimes there's some inheritance with it, meaning the genes has a factor to play in the type 1 diabetes. Some people will end up having some type of infection or some kind of an illness that will attack the beta cells in the pancreas, which is involved in the production of insulin. So these kids will not have insulin, they get real sick, and they end up being admitted, and after testing, they will find out they're diabetic. So with those people, they have to be on insulin for the rest of their lives. But still, they can manage their blood sugar levels by avoiding anything that is really high in carbohydrates or high in sugar content, which is going to allow them to use minimum insulin that they're going to use on a daily basis to prevent them from getting complications that are associated with insulin. But now the problem is most kids also have diabetes. I have kids that are 9 years old that have diabetes, and they have type 2 diabetes. And most of these kids are usually obese. And it's mostly related to diet, because now you have a kid, especially in the West or even in Africa, that drink at least about 5 sodas a day. Or they eat donuts for breakfast, followed by a glass of orange juice. Lunchtime, they eat a hamburger, followed by a soda. And in between lunch and breakfast, there's bags of chips and sodas and juices, okay? Before dinner time, there's more bags of chips, sodas, and orange juice. Dinner time comes, same thing applies. Pasta, macaroni, and cheese, you name it. So by the time this kid is even 10 years old, they have consumed more carbohydrates than back in the days, a 50-year-old. So now you see diseases that are more common in young kids now that used to be only attached to 50 years old and older. So the treatment is not any different. Kids have to be managed. Adults have to take responsibility. You are the ones that buy the food. If you don't buy it, they will not use it. If they only have these foods only when they go out, and even if you go out to restaurants, you avoid getting sodas or things that are high in sugar, eventually the kid will be used to it. Because I don't buy sodas in my house. I don't buy anything that is high in sugar concentration. So li Marem laajte foofu mooy ne xale yi nga xam ne nag ñoom dañuy am diabète ndax ñoom naka la ñuy mun a fexee ba xale yooyu duñ am diabète. Xale yi feebari diabète buñ daan am mooy bi nga xam ne moom la ñuy wax type 1 mooy fànn benn bi nga xam ne moom lañ xamee woon ay xale. Xale yooyu lu tax ñu daan am diabète boobu mooy ne dañ daan am benn feebar bu lañ attaque di xëj na dafa dox si seen famille, maanaam dafa topp seen gene. Bu ko defee xale yooyu dañuy am benn feebar boo xam ne dafay attaqué organe bi nga xam ne mooy defar insuline moo tax ngay mun a jël suukar si di ko jëfandikoo. Léegi nag xale yooyu duñ mun a tee am insuline, bu boobaa foog ñu jox leen insuline pour ñu dund. waaye même xale yooyu buñ amee diabète bi nga xam ne moom la ñuy wax type 1 mun nañoo bañ a sonnal seen bopp trop, waaye dañuy éviter di lekk lépp loo xam ne dafa am suukar wala bara dafa bari suukar. Bu ko defee lu ñuy soxla si insuline du bari. Ndig insuline dafa ànd ak feebar yu baree nga xam ne nu baree si sa yaram rek noonu la gën a mun a indee problème. Nuñ la ko joxee pour piqûre la noonu la gën a mun a indalee problème. Dëgg la dina wàññi suukar si, waaye yàqu-yàqu gi muy def si yaram moo ëpp njëriñ lam lay indil. waaye léegi nag feebari xale si suukar bari na lool te li ko waral mooy lekk ndik xale yi fi mu nekk ku si xëy suga di nga lekk donuts wala di nga lekk croissant nga lekk fonde ñu defal la si soomu bari am suukar ñu jox la mburoog beurre ak pomme de terre ñaar ñooñu ñëpp am suukar nga añee ceeb diggante reer ak ndekki diggante añ ak ndekki nga naan si ay jus lekk si ay mbir yoo xam ne lépp mara de taan guddi ñu joxati la ay pasta wala macaroni nga reeree ko kon xale boobu li muy am si suukar balaa muy am fukki at dina tolloog jamono maam ya seeni borom luñ daan am si suukar suñu amee juróom fukki at moo tax fi mu nekk feebari mag yi moo nekk feebari xale yi te loolu lu ko waral rek mooy suñ dundin ak li ñuy lekk. Thank you, Mariam, for that question. That was really important for us to know that it is our responsibility. Maanaam suñu warugal la pour waajur mu fexe bum di jënd lekk yi nga xam ne dafa bari suukar si kër gi. Ndik ñun waajur yi buñ bàyyee xel lu ñuy lekk suñ njaboot dinañ mun a bàyyee xel lu ñuy lekk waaye bu waajur xamul lu muy lekk li muy jàngal njabootam li mu xam rek la ko mun a jàngal kon moo waral lii nga xam ne mooy jafe-jafe yi ñuy dund si suñu askan mooy ñàkk xam li ñu war a lekk ak li ñu war a dundee ak li ñu war a toppatooyee suñ bopp. jërë ngeen jëf.
Sorry about that.
Any questions, Juka?
No, I was just opening it to the floor back again for them if they have any questions. Great questions for sure. So far, it's been good.
Thank you.
Assalamu alaikum. Dr. Diaye, maa ngi lay nuyu man la Amar. Sama question bi c'est par rapport à ñun ñi nga xam ne dañu am ay waajur yoo xam ne dañu jëmee mag ñooñu effectivement naka nañuy def pour justement pour que seen alimentation parce que souvent dañuy ñëw am ay hypertension kenn xamul lu ñuy wax Sénégal donc naka nañuy def ba conseiller leen ci alimentation bi nga xam ne moom lañu bëgg war a bañ a am daal.
Wow, jërëjëf Amar, loolu am na solo trop. What Amar asked there is that what can we do for the older people, especially those that are in Africa, to avoid them from getting diabetes, or if they have diabetes, what can we teach them to help take care of themselves? Amar, li nga laajte noonu am na solo léegi mag moo gën a téye doy waar sax si wàllu dundu si wàllu lekk ndik mag ni ngay gën a jëmee mag rek léppay yéex si sa yaram. Maanaam boo lekkee balaa muy digérer dafay jël time balaa muy digest dafay jël time dina fekk li nga dundoon si sa ndaw yëpp si wàllu lekk fi mu nekk dafay commencer di feeñ moo tax feebari diabète ak feebari tension mu nekkoon feebar woo xam ne feebari mag la woon léegi nag ki nga xam ne dëndu na ba tollu ay juróom fukki at jëm kaw kooku dina yomb pour mu am diabète ndik suukar si dajaloo si yaramam bari na bari goo xam ne maara day taane léegi nag est-ce que ndax kii mun nañ koo dimbale ba lii nga xam ne mooy diabète bu mu ko sonnal waaw kooku ni nga koy dimbalee rek benn faj la waajuru mag woowu war naa éviter di lekk lépp loo xam ne dafa am comme ceeb ndik suñ réew yi dañuy faral di lekk ceeb ndekkee mburu añee ceeb reeree mburu wala reeree pomme de terre kooku benn dina am feebari lu ñuy wax constipation mooy dina seere ñaareel bi suukaram dina bari tension yam dina éeg lu tax ñaar yi di am ndik pour nga bañ a am constipation maanaam sa bañ a seere da nga war a am lu ñuy wax fibre maanaam lu mel ni dugub dafa bara bari sa lekk lu mel ni légume dafa war a bari sa lekk te légume bi moo war a ëpp ndik bu légume bi ëppee rek bu boobaa tension bi naka suukar si dina wàññeeku bu suukar si wàññeekoo insuline bi dina wàññeeku bu insuline bi wàññeekoo tension bi dina wàññeeku lu tax tension bi di wàññeeku bu suukar si wàññeekoo mooy ne bu insuline wàññeekoo rek dafay yokk li nga xam ne moom la ñuy wax nitric oxide. Nitric oxide du lenn lu dul benn chemical boo xam ne dafay nekk si biir raakool yi deret yi di jaar pour mu ubbi ko. bu ko ubbee tension dafay dal di wàññeeku moo tax ñaareel boo gisee nit ku am jabet rek day dal di am tension. te seeni borom dañu war a éviter di lekk toujours. ndig boo demee ba jëm mag soxlaatuloo kàttan wu bari pour liggéey da ngay toog benn barab te mag yi dañ war di yëngatu loolu dina lañ mun a dimbale pour seen cër yi di bañ a am problème ñu bañ a am constipation ñu bañ a yokk seen tension ak seen diabète. kon mag yooyu noonu waratuñoo lekk ñetti yoon ci journée bi buñ lekkee bu baree ba bari warta ëpp ñaari yoon te bu féetew guddi liñ war a lekk warta am lenn loo xam ne dafay diis seen yaram xëy na ay salade lañ war a lekk loo xam ne dafa war a oyof warta am cere wala léjum ceeb. ay cere dañ koy baaxee di ko lekk guddi suñu réew yi waaye waxtu wu baax pour ñu lekk ceeb mooy ak cere mooy si diggi bëccëg bi nga xamee ne nit ki mun naa jóg yëngatu. nit bu guddi di jot si rek li nga xam ne mooy insuline sa yaram bi dafay commencer di préparer nelaw te kuy nelaw warta lekk te insuline mooy tax nga mun a jël li nga lekk dugal ko si cellulaire yi pour mu amal la njëriñ waaye su guddi gi dëgmal si rek loolu dafay dal di commencer di effacer sa yaram bi di génneeti insuline. moo tax boo lekkee waxtu woowu soo xëyee suba sa suukar dafay éeg trop surtout malaase ñi nga xam ne dañ am jabet. surtout malaa nag bu dee borom dafa lekk loo xam ne dafa am high glycemic index mooy lu mel ni ceeb kooku bu demee ba benn waxtu si suba rek suukaram day dal di wàcc trop ba nga xam ne moom si boppam dafay eewu su eewoo dafay uti lum lekk soo xasee ba am nit koo xam ne amagul jabet sax ngay gis bu benn waxtu jotee ñaari waxtu jot rek muy eewu ngir xiif bugg a lekk rek borom na dem seeti boppam. kon mag moomu war naa éviter lekk gu bari mooy ne benn yoon si journée bi lekkam war naa doy su buggee lekkantu mun naa jël ay fruits yi nga xam ne bariwul suukar wala mu lekk ay légumes loolu moo gën si mag bu ko defee dina éviter mu bàyyi wàññi diw gu bari wàññi ceeb gu bari di yëngatu mag rek taxul nga bàyyeen ndeku ndig dafa am lu anglais di wax you don't use it you lose it maanaam boo ko jëfandewutee rek danga koy perte. What Amar asked there is very important in terms of the older population. The older you are, the more likelihood of you getting diabetes or high blood pressure. The reason is simple. Over the years, you accumulated a whole bunch of blood sugar in your system, and now you also have insulin resistance, meaning you have a lot of insulin, but it's useless. And then the older you are, the more likelihood that your metabolism is going to slow down. You're going to gain weight. And I think the gaining of the weight is nothing to do but with the insulin resistance. Especially for us females, then you start having abdominal girth, meaning you have obesity around your abdomen. So an older person should not eat 3 times a day. It is not needed because their energy level or when they consume energy is not real. They don't really do much except if you are active, but the African older person usually is not that active, so they should not eat 3 meals a day. And they should not eat snacks because every time I ask someone, what have you been eating? They say, I don't eat. I only eat 1 time a day. When I ask, what have you been snacking on? Then they will tell me a whole bunch of stuff, which is even more than a meal, or may drink even 5 sodas a day. So the older person should limit the amount of times or the number of times they eat. The older person probably should even do more intermittent fasting or fasting in general and eat once a day. And when they eat, if they have to eat anything that is high in carbohydrates, it should be during the day around 2, 3 p.m. or even noon to allow them to have time to spend that energy. Because as the day goes by, your circadian rhythm kicks in, meaning it's time for you to get ready to go to sleep. So in the evenings, you produce less insulin. And that is why most of the time when you eat anything in the evening, it doesn't get digested very well because your system is slowing down, it's getting ready to sleep. Your stomach is getting ready to sleep. And most of the time, older people also have problem with constipation because they don't move around as much. They consume a lot of carbohydrates. So the older person should consume more fiber food, less glycemic index food, and less times to eat as well. Thank you, Amar, for that question. If you guys have any more questions.
Yeah, I have a follow-up question, Dr. J, to Amar's question. Because I think you mentioned that older people, it's recommended for them to only eat once a day. And I'm sure a lot of older people, if you tell them that, they
How are you?
pretty kind of devastated or scared because they're used to eating 3 times a day. So what can you like describe like the typical, like what can they eat apart from just eating that once a day in terms of like snacks? Like what is the recommended type of food, let's say, they should consume for breakfast, lunch, and dinner, instead of the typical, I guess, 3 meals a day that they were used to eating?
Yes, thank you. Thank you for that question. So the older person should eat less. All people should eat less than we eat. We all consume more than we need. That is the number one factor. So the older person, because their metabolism has slowed down, they don't need as much energy. So this person can still eat 3 times a day if they want to, but this is what I would advise older people to do. When you wake up in the morning, your energy level is high, your sugar level is high. Don't eat breakfast early. Wait till about 10 o'clock or 11. If you're not used to eating at 10 and you're used to eating at 8 o'clock in the morning, I'll say start practicing. Move your meal forward to about 9 o'clock one week, and then 10 o'clock the next week, until you get to eat at probably lunchtime. So therefore, you are not eating breakfast, or even if you eat breakfast and you want to eat breakfast food at noon, then you can eat omelets. When you eat omelets at noon, what is the chance that you're going to eat again between noon and 6 p.m.? It's very unlikely. And if that person wants to snack, let's say they don't want to eat anything, they don't want to eat breakfast, but they just feel like they need to munch on something, nuts are real good. Like almonds, Brazil nuts, hazelnuts, all the nuts that are out there are great, but just don't overdo it. Just do it in moderation. If they want to eat yogurt, because most of the time people say, oh, you need calcium. Well, you can have calcium, but not necessarily from milk. And if you have to have milk, it should be less. It shouldn't be the low-fat milk. It should be the full-fat milk. So let's say the person wants to eat veggies instead. You can eat celery, you can eat carrots, which also has sugar, but not as bad because it doesn't have the high glycemic index. You can have fruits, but also make sure it's in moderation. Don't eat a whole plate of fruits. You can do the green apples, which is great. So for those that are in Africa, they should try to consume the fruits that are in Africa. And those fruits are better for them because they can easily digest it. So let's say they want to eat dinner. They've already had eggs for breakfast, or they have oatmeal for breakfast, or what we call riz or fonde. They can have that around noon or for breakfast. That's fine because that increases their fiber content. And then they don't want to eat lunch. They just want to eat dinner. They can have salad with chicken or fish or whatever, grilled meat, not later than 8 o'clock if they have to go to bed at 10. But I would advise any old person not to eat anywhere between after 6 or 7 p.m., which is not the norm in Africa. Most people eat dinner at about 9 p.m., which is super late, because by then you are not producing any insulin. And that is why a lot of our people are dying nowadays, because of how we eat and when we eat. Because the main problem with eating is not just how much you eat, but when do you eat, how do you eat, and what do you eat? Those are the 3 questions: when, how, and what. When, you should not eat too early because you already have hypoglycemia in the morning. What should you eat? Half of your plate should be veggies, 1/4 carbs, and the other quarter protein. And that applies for all ages, whether it's an old person or young person, if you have to eat. How often should you eat? You should eat only when you are hungry, not just because you're used to just eating or it is normal to eat 3 times a day. In Africa, breakfast, everybody stops everything and eats. Lunch, everybody stops everything. Dinner, same thing. Only eat when you are hungry. And you are hungry just because you customize yourself to be hungry. So the hunger hormone called ghrelin only lasts about an hour. That is why when you don't eat for a while, then you have food, you don't even feel like eating, because that hunger hormone only lasts for about an hour. When you resist, it will say, oh, this lady is really crazy. I don't need to mess with her. She doesn't want to eat. So what she asking, I'll translate that in Wolof. Sànqali kii laajte mooy ne màgget mi nga xam ne dafa bugg a lekk te ñun suñ aada dañ baaxoo di lekk ñetti yoon si bés bi. mooy ne kenn warta lekk ñetti yoon si bés xanaa mu doon ne da nga xiif te booy xiif rek mooy da nga jëfandikoo li ngay lekk, like athletes, those people that play sports. kon màgget mi nga xam ne dafa bugg a lekk ñetti yoon, màgget moomu même bu dee dafay lekk ñetti yoon li mu war a lekk mooy li ñuy ooyee snack fii, mooy mun naa lekk ay gerte, lu mel ni maanaam gerte. te bu mu ko lekk suba teel na xaar ba boori midi. bu tàmmtee di lekk midi nga xam ne dafay jóg rek lekk, bu dee juróom-ñetti waxtu si suba la daan lekk, mun na koo puus mu dem ba juróom-ñeenti waxtu si suba, puusaat ko ba fukki waxtu ba mu egg midi. nga xam ne midi bu buggutee lekk sax mun naa jël tuuti gerte rek yéentu ko, pare na ci. li mu war a ëppal si boppam mooy ndox. bu dee nag dafa bëgg a lekk añ, reer ak ndékki mun naa lekk nen, wala mun lekk li nga xam ne comme fonde la, waaye bu mu si lekk lu bari. bu dee dafa bëgg a añ mun naa añee ceeb, waaye na fexe genn wàlli asetam bi muy lekkee légume la, beneen genn wàll gi mooy côté bi boo divisé, boo xaajee aset bi ñeenti yoon, ñaari xaaj yi légume la, benn xaaj bi mooy nekk ceeb ak fruit, mooy lépp loo xam ne dafay soppaleku suukar, beneen xaaj bi nag mooy nekk ndawal, jën, lu munti doon, loolu moo fa war a nekk. kon ki nga xam ne dafa féetoo mag warta guddee lekk. ñun nag dañ baaxoo di reer ay juróom-ñeenti waxtu si guddi, waaye reer warta paase juróom-ñaari waxtu si ngoon. dafay fekk li nga xam ne moo war a préparer pour nga tëdd nelaw commencé na, te kon su boobaa lekk bi du jàll, dafay toog benn barab. te ki nga xam ne dafa màgget tamit war naa continuer di yëngal yaramam, di naan ndox mu bari, di lekk li nga xam ne moo koy dimbale pour bu mu seere, waaye moo koy dimbale tam mu bañ a am ay tension ak diabète. Thank you.
Thank you, Dr. J. It's great. You have a question on the Facebook. It's from Auntie Tukulor. And she says, Dr. J, I use organic stevia in my tea. Is it a good supplement to sugar? I guess, is it a good substitute to sugar? And then that's the first thing she asked. Mohammed and I eat omelette for dinner every Sunday. Okay, yeah, so that's the question she wants to know about the organic stevia. Thank you.
Thank you. So anything that has a substitute for sugar is no good. When it says it has sucrose, when you look at the package, check for what it says, sucrose. If it has LOSE at the end, what that does is that it lowers your microbiome in your gut by 50%. The microbiome in your gut, it's a little bit more in depth, but I'll give you a little bit of a hint about it, maybe at a later show, or I may record something about the microbiome and how it's important. So food is important, medicine is important, but the only time you can take medicine and it benefits you, and you take food and it benefits you, your microbiome in your gut, meaning in your stomach or your colon, has to be in alignment with you. So when that microbiome goes down or decreases, it creates a lot of GI problems, a lot of stomach problems. And all of those sugar additives or substitutes decreases the microbiome by 50%. So when you have a low microbiome, you will end up having yeast infections, even if you're not diabetic. And then you'll continue to take yeast infection medications and it will never eradicate. That's why we tell you to take a probiotics, because you have pro, pre, and all of these are important for you to be able to digest the food and utilize the nutrition from the food. So if your microbiome is low and you take food the food is not going to be useful because half of it is not going to be processed or absorbed, same as the medications. And that is why when you look at the West, we have so many diseases from Crohn's disease, ulcerative colitis, irritable bowel syndrome, and most people in the West will also have lactose intolerant because of the microbiome is not able to process that food. So if you're trying to avoid eating sugar, sugar is not needed in our diet. Nobody needs sugar to survive. Sugar is just for the taste bud. And it's just because we trained ourselves to get receptive to sugar or like sugar. The minute you stop eating sugar, even a drop of sugar in a tea or coffee, you will not be able to drink it and it will be bitter. When you stop eating sugar or sweet stuff, now you are going to start tasting fruits and vegetables to be sweet, even if they were not sweet before. And the other problem is if you start eating sugar substitute, even if it doesn't destroy your microbiome, the body is very interesting the way it functions. The minute your body is used to sweets, when you taste anything that's sweet, even though it's not sugar or doesn't have sucrose or fructose, whatever you may call it, the brain is going to sense the sweetness and is going to start releasing insulin. And the insulin is the detrimental hormone in your system. Insulin will reverse you to become PCOS. Insulin affects women in terms of endometriosis. Insulin causes you to have inflammation. Inflammation can cause you to have heart disease. Insulin can cause you to have joint problems. So yes, you are avoiding your blood sugar to rise, but you are not avoiding yourself from having insulin resistance. So what I just said there in Wolof is that she asked, how can she take sugar substitutes? And my answer is that all sugar substitutes, yes, they are not created equal, but they have a detrimental results at the end. Some sugar substitute will cause your dina def sa li nga xamne mo nek ci sa mbax gi ndik dafa am yenn li ñuy wax microbiome bu nek ci mbaxi doom adama bu lekkee loolu mooy tax sa yaram wi mun a jël li nga xam ne mooy lekk gi léegi nag boo jëlee li nga xam ne moom la ñuy wax sugar substitute maanaam luñ bëgg a fajee feebar ñi am jabet liñ la ñuy jox suukar yooyu baaxul si yaram ndig dafay wàññi loolu nga xam ne mooy microbiome bi nekk si mbàq si genn wàlli xaaj bi léegi nag bu loolu wàññee ko mooy waral boo lekkee yenn lekk yi sax du la amal njëriñ wala boo jëlee garab du la amal njëriñ nit loolu mooy tax lekk gi dugg sa biir yaram nga jëriñoo ko beneen bi mooy ne dina indi yenn feebar yu ñuy wax biiri tajji biir yuy daw moo tax nga gis ñaareel ñi am jabet dañuy am wëccu wala seen biir yi di daw toujours loolu boo ko gisee rek xamal ne seen microbiome moo wàññeeku même boo amutee jabet di nga gis ne da ngay faral di am li nga xam ne moom la ñuy wax yeast infection yaakaar naa moom la ñuy wax soccet si olof loolu lu ko waral mooy ne sa microbiome bi sa mbaax moo dal di soppeeku même bu dee wàññiwul sa microbiome li muy def mooy ne yaram wi xel dafa baax ni yàlla nim ñu bindee rek sa xel mi boo ñamee loo xam ne dafa toxamtal ak suukar rek bu boobaa xel mi daf la naan yaram wi génneel li nga xam ne mooy insuline te loraange gi ëpp si hormone mooy insuline bu insuline génnee rek bu boobaa di nga am mun ngaa am cardiaque mun ngaa am stroke mun ngaa am lu ñuy wax feebari genou muy feebari oom ay yax yuy métti yax yu ñu naan dafa am inflammation loolu yëpp insuline moo koy waral kon li am solo daal mooy éviter pour tàmmal sa bopp lu saf suukar boo tàmmalut sa bopp lu saf suukar rek di nga mun a lekk-lekk yu bari yoo xam ne amul suukar te du la sonal nit tàmmloo ko nit ki loo tàmm rek ngay namm loo tàmmut doo ko namm. Thank you, Auntie Tuku.
Yeah, thank you, Dr. J. It's great. Ole, I hope you're listening very well. There's one, somebody else asked a different question. Let me see. What's your take on the Heinz baked beans? I guess the baked beans, I prefer the sugar-free. What's your take on that? And then I wanted to ask quickly, I'm not sure when you're wrapping, we're getting to the 1 hour mark, but I wanted to also ask if there are any things that you suggest as far as like natural remedies, natural things. I know Pausman used to say tamarind was good for people that have diabetes and stuff like that. So anything that you can share, especially the fact that this person is talking about baked beans as well. Thank you.
Thank you. That's a great question, Juka. I'm glad they're participating on the Facebook. So baked beans, anything that has a barcode, anything that has a barcode is not healthy because it's processed. They will tell you this is a low calorie diet or it's healthy or it, whenever they tell you there is healthy, this is healthy, go look at the package. Look at the amount of added sugar. Look at the different names of sugar because there is a lot of different names of sugar. And all processed foods usually have sugar in them. Even chicken wings processed in a bag has sugar. Look at the labels. The reason why, because it helps the cell life to continue to be good. So they can continue to sell so this food doesn't go bad. So it's in the best interest of the seller or the manufacturer, but not in the best interest of the consumer. So it's the consumer that has the full responsibility to educate themselves. So I would say if you want baked beans, please bake them yourself. The food that are good is the one that you know what you put in it. All processed foods are not good. I can say maybe once in a while. So this is the philosophy that I have. Anything that you do and you want to be great, do it at least 80% of the time. If you go visit Juka or Ole, like when I go visit Ole and she gives me baked beans and there's nothing else to eat and I just want to taste it, I'll just take a little bit of it. But I'm not going to eat it every day or every other day or once a week. No. So all processed foods are not good, period. Anything that has a barcode, leave it alone, especially if you're diabetic or pre-diabetic or high blood pressure or heart disease. Now, beans also are good, but there is something called lectin that is in beans. When you cook beans, you should soak them multiple times, rinse them, and cook them, slow cook them. Or if you have a pressure cooker, you can cook them in pressure cooker. Then it destroys the lectin because the lectin will destroy your gut health and will create what we call leaky gut. So there's a lot to medicine and food that is very relatable. So for Juka that was asking the question about what are the things that you can do, like my uncle that just passed away, that's why I cannot believe that he had diabetes because he was so passionate. We talked a lot and he knew how passionate I was about food. And we discussed everything about food and the benefits of a lot of foods from Africa, like tamarind. He gave me that recipe. He said, if you have diabetes and you drink tamarind, it lowers your blood sugar. Absolutely. I tested it and it does lower your blood sugar. Even the tamarind seed has a lot of benefits, which he shared with me. So if you want calcium and you are not wanting to drink milk because you're diabetic, you don't have to have the calcium. And sometimes even the calcium that we sell may have some processed stuff inside the calcium. So what the calcium pills, the calcium tablets for that matter. So what you can do, you can eat baobab, has a high concentration of calcium, has a high concentration of vitamin C, especially if you want vitamin C and you don't want to buy the supplements, you want to buy the natural product. Baobab has more calcium and vitamin C than oranges. Especially if you're diabetic and you want to have vitamin C, you should avoid oranges because guess what? Oranges is what we tell you to take if you're hypoglycemic, meaning if your blood sugar is low. So if you're diabetic, avoid all juices because when you eat the fruit itself, the fruit is going to contain the fiber, but it's also going to take time for your body to process it. When you juice, even when you juice your own fruits, it's going to be different from the regular fruit that you're going to consume. When you juice your fruit, you've already started the stage 1 of metabolism, meaning breaking down the food. So now you're going to change the sugar molecules. If you do chemistry, you change the sugar molecule where it will be faster for your body to absorb it, where it's going to cause you to have a high glycemia or hyperglycemia in your blood. So it's better to eat the regular fruit than to juice the fruit. Even the veggies is better. I know there's a lot of hype about juicing and juicing and juicing. Juicing is good if that's all you want to detox and juice for the veggies and you drink only that. But if you juice and you're diabetic, you're going to see a spike in your blood sugar level. Lima wax fofu sank moy ki doon laajte ci ñebbe bi nga xamne dañ koy jaay ci pot bi ñukoy wax baked beans ñukoy faral di lek ak ndéki ñebbe yoy lepp lo xamne dafa am barcode manam li ngay scanner pour jënd la ñu def ko ci ay pot baaxut lepp lo xamne dañ ko process manam dañ ko deub dañ ko defar avant bala nga koy lek baaxut surtout mala bu dé da nga am diabète bu dé da nga bëgg sa ñebbe bop togal ko sa bop ni nga koy toggé nak dafa am fànn noo ko war a defaree ñebbe bi nga xam ne ñebbe yiñ faral di togg ñun danga koy xooj raxas ko xoojaat ko raxas ko ay yoon ñett ba ñeent soog koo togg waaye nga togg ko togg boo xam ne du gaaw bu ko defee am na lenn lu ci nekk lu ñuy wax lactine nga xam ne dafay xotti mbaaxi doomu aadama ba muy indi yenn feebar yi bu boobaa loolu du si am te di nga gis ne tamit du la jox yenn ngay ngelawal lu bari kon doom aadama lépp loo xam ne moo ko bëgg a dundal boppam rek moo ko war a defaral boppam li nga xam ne moo gën a bari temps yi mooy ñi nga xam ne dañuy bëgg a juice pour ne moo gën a baax mais fruit bi nga xam ne danga ko lekk noonu ni mu lëmmee noonu moo gën fruit bi nga xam ne danga ko jël process ko maanaam danga ko wol dëbb ko ba moo jël ndox ma naan ko ndox moomu moo ëpp suukar te suukar soosu bu duggee sa yaram rek dafay égal sa diabète kon moo tax dafay am solo ñi am diabète ñuy éviter yu ñu mel. Thank you, Juka, for that question. If there is any more.
And I think you should touch on the natural parts in the local language. I don't think you did. I think you forgot.
Thank you. Okay, thank you. Juka mu may fàttali ne fàtte naa wax ci kàllaama wolof li nga xam ne mooy lekk yi nga xam ne dafa am solo surtout mu laa ki nga xam ne dafa am diabète wala muy waaje am diabète wala mu bañ a am diabète ndik su dee da nga bëgg vitamine C ndik ñun ñëpp xam nañ ne jamono yiñ toll ni Covid bi mu ngi bari woon nit ñaa ngi jéem a moytandiku te vitamine C sax dafa baax ci yaram dafay dimbale doomu aadama suñ jigéen yi suñ moromi jigéen yi sa yaram li ngay dundee ci sa biir mooy feeñ ci sa yaram mooy feeñ ci sa deri yaram te vitamine C bokk na ci li nga xam ne dafay def sa yaram leer benn danga ko lekk wala danga ko bindee danga ko diwoo lekk gi sax moo gën a am solo ki nga xam ne dafa am diabète kooku vitamine C bi muy naan war koo jëlee ci li nga xam ne mooy orange wala oranges mun na koo jëlee ci li nga xam ne moom la ñuy wax baobab muy buy moo ëpp li nga xam ne mooy vitamine C ak li nga xam ne mooy calcium kon ki am diabète bañ a naan meew bañ a naan jus mun naa naan li nga xam ne mooy buy te buy boobu it na fexe mun na ko yëngal naan ko noonu nit ki bu fàttee suukar rek làmmiñam lépp lu ñam rek dina saf suukar bu dee koo xam ne la nag moom amut suukar jéemuta am suukar waajuta am suukar mun na see def tuuti lem lu tax lem bi tam dafay yëgal suukar lii différence bi rek mooy ne li ñuy wax high glycemic index maanaam du gaaw a yéegal suukar si torop dina jël temps waaye benn tey dina yéegal suukar kon dafa am lekk yu bari yoo xam ne dafay indil njëriñ ki nga xam ne dafa am diabète lu si mel ni moringa will lower your blood sugar level. It's the highest leaf, is the highest protein, is the leaf that has the highest protein. Moringa mooy mbuum baax na si ki nga xam ne dafa am diabète dina wàññi suukar waaye dina def tamit ki nga xam ne dafa am diabète dafa soxla protéine kooku moringa dina baax si moom trop mu lekk ko ak cere wala mu lekk ko mbuum noonu wala mu defal ko salade wala mu jël ko def ko sunguf sotti ko xóoyal ko def ko si salade dressinam sotti ko si lekkam ndig dina wàññi suukaram waaye dina yokk protéine am. So why is moringa important? For those of you that don't know moringa, moringa is a leaf that comes from Africa. It's a plant. And it's the highest protein. is the plant that has the highest protein. And why is that important for diabetics? Not only does it lower your blood sugar level, but remember, the person with diabetes usually experience hypoglycemia. Why? Because this person eats carbohydrates, and when they eat carbohydrates, an hour later, they're going to become hungry. If they don't refuel their carbohydrates again, guess what? Their cells are going to be starving with sugar, and they're going to start getting jittery. Their blood sugar is going to bottom out. So what does this person do to avoid hypoglycemia? That means low blood sugar. This person has to have more foods that are low in glycemic index, meaning protein, like meat. What we all know, a lot of meat also can be a problem. So that is why moringa is very important, because moringa has high protein, so it's going to allow your blood sugar to drop, but it's not going to give you the hypoglycemic effect. Because if someone has hypoglycemia, you usually give them sugar or juices that added sugar, so their blood sugar can go back up. But the best thing to do is to avoid your blood sugar from going low so fast. So this person needs to eat more foods that have a low glycemic index, meaning more veggies and more protein. But the best protein would be from this plant called moringa. So these are the benefits of moringa. For those of you who are diabetic, it's important for you guys to go out and get some moringa. Use it as a powder form. You can add it in a salad dressing, make your own salad dressing instead of buying salad dressing. One serving of salad dressing would have about 32 grams of sugar. And 20 grams of sugar is about 5 teaspoons of sugar. If you watch my reversing diabetic video, you would see that I showed you guys the amount of sugar. So, li ma wax fofu sank moy ne lek bi nga xamne dafa am solo muy mbuum te ñun xamuñ njëriñ li moy mbuum wala muy nebedaay. Lutax nebedaay am solo si ki nga xamne dafa am jabet wala ki nga xamne buguta am jabet moy ñaari fànn. Benn dafay wàññi suukar pour bu mu eeg torop. Waaye it dafa am lu ñuy wax protéine te ki nga xam ne dafa am jabet nag ñaareel seeni borom ñenn ñu si bari dañuy faatu ngir suukar su wàcc torop ndig yaram bi dem na ba tàmm suukar bu lekkee lu am suukar rek benn waxtu bu paasee rek dafay dal di xiifaat bu lekkutee suukar bu ñeenti waxtu jotee rek dafay commencé di lox suukaram wàcc waaye kii li mu war a lekk ba éviter lu ñu mel mooy ne dafa war a bàyyi lekk lu saf suukar. waaye dafa war a ëppale li nga xam ne dafa am protéine nga xam ne dina yàgg si yaram wi balaa suukar si di wàcc moo tax li nga xam ne nebedaay moom mooy li ëpp protéine xob bi nga xam ne dafa ëpp protéine kon moo tax li nga xam ne nebedaay mu am solo kon kii nga xam ne dafa am jabet moom nebedaay war na koo mën a lekk benn pour mu wàññi suukaram waaye beneen bi pour mu bañ koo def ba nga xam ne suukaram dafay wàññi ba mu si mun a jëlee loraange wala muy si faatoo kon li nga xam ne mooy nebedaay benn la li nga xam ne mooy buy baax na li nga xam ne mooy daxaar baax na ndig moom it dina tax sa doo am lu ñuy wax constipation maanaam doo seere waaye dina dimbale tamit nga wàññi suukar waaye ki nga xam ne dafa am yaram tam daf lay dimbale pour sa yaram wàññeeku. Thank you, Juka. I think I covered in both
yes,
Wolof and English.
Yeah. You have few more. I know we already passed.
Yeah, I timed it for 1 hour, 30 minutes. So if that's okay.
Yeah, you have, I think, few more on the chat. Let me see. So Sister Sonia suggested, say something about cinnamon, that it's actually good. And if you had, for diabetes, if you had anything to say about that, looking to get back into the chat. Yeah. My husband is a diabetic, is a type 2 diabetic borderline. We have found cinnamon bark to be very helpful for his diabetes. What do you have to say about cinnamon? And then this last person say, I have a question about eggs. I heard that it's not good to eat eggs every day. Please advise. Thanks, Oli. So those are the two questions that we have before we close.
Thank you, Sanya. Thank you for being here. So, so Sanya asked about cinnamon. Yes. So cinnamon has a lot of health benefits in terms of decreasing blood sugar as well. Cinnamon is an anti-inflammatory, number one. It decreases inflammation. So if you're diabetic, obviously you already have insulin resistance. So you're going to have a lot of inflammation. So using cinnamon as a spice, or even sprinkling it on your food, or even putting in a drink would help with your blood sugar level. So when you talk about treating diabetes or treating blood sugars, it's great to also know the things that will lower your blood sugar, but that's not the main concept. The main idea about reversing diabetes is to reverse the insulin resistance. So all the things that we talked about, like the baobab, the tamarind, the moringa, the cinnamon, you name it, cloves. Cloves also would lower blood sugar, but it has anti-inflammatory effects as well. Ginger, the same thing. Garlic, the same thing. So all of these are real good if someone is diabetic. Yes, it will help you lower your blood sugar level, but does it help you lower your insulin? No, because the main problem here is insulin production. So the key factor in reversing diabetes is to lower your insulin level. How do you lower your insulin level? It's two things. Food, we talked about, and fasting. Because the only thing that will not produce insulin is not eating or eating fat. And you don't want to eat fat only, and you can't even only eat fat. Protein has one part of it that will produce insulin, and carbohydrate is even worse. So it's no carbohydrates and fasting. Yes, all these other things, turmeric, cinnamon, moringa, ginger, garlic, only treats hyperglycemia, meaning high blood sugar level, but it does not reverse all the other issues that comes with insulin resistance. So if you want to reverse diabetes, it's fasting and low carb. And I came up with this 3 concept is GPS. If you want to reverse diabetes, use your GPS. Your GPS is your no grains, no potatoes, no sugar. Now, if you want to lower your high blood sugar, meaning hyperglycemia, then you can do the cinnamon, you can do the moringa, you can do the ginger, you can do the garlic, you name it. Yes, but that's not the optimal goal. What you want to do is to get away from the problem. And if you want to get away from the problem, it's very simple. It's very doable. Yes, it may sound complicated, but that's why we are here to assist people, to show them how to do it in the right way so they can get the maximum benefit and not have the complications of diabetes. Because with diabetics, when you have a heart attack, you don't even know it because it destroys the neurons that sends the pain signal to your brain. So that's why diabetics will end up with ulcers on their feet. They will end up with impotence, like for the males, they have erectile dysfunctions. And that's because they're not sensing, even if they don't have the dysfunction, they're not going to enjoy sex as they would have if they did not have the neuropathy. So these are issues that are there that comes with insulin resistance and diabetes. So if you think about it, you can sacrifice the 9 months, reverse your diabetes, and then know how to maintain a healthy lifestyle without going back to the problem. So li ma wax foofu sànq suñ mbokk bi Sanya dafa laajte mu ne li ñuy wax cinnamon benn spice la ndax loolu di am na solo si diabetic jabet waaw cinnamon dina wàññi jabet lu bari sax cinnamon laaj daxaar moringa ginger yu si bari dina wàññi li nga xam ne mooy jabet waaye dina wàññi suukar su bari waaye du wàññi feebar bi si boppam suukar si bari si rek lay wàññi te ñun li nga xam ne moo ñu soxal mooy naka la ñuy fexee ba ki am jabet bu mu ko amati suukar su bari si nag wàññi ko am na sens waaye loolu léegi rek la lay jëriñ waaye si ni àddina di gën a yàggee ngay gën di am problème di gën di soxla garab yu bari di gën di soxla di naan yii pour nga bañ a am suukar su bari léegi li si am solo mooy naka ngay fexee ba li nga xam ne mooy jabet bi nga génnee ko si sa yaram loolu ni nga koy defee rek ñaari fànn la mooy li ngay lekk bu mu bari suukar mooy ne bu nga éviter li nga xam ne moom la ñuy wax ay dugub ay ceeb bàyyi li nga xam ne moom la ñuy wax suukar bàyyi li nga xam ne moom la ñuy wax pomme de terre wala ak ay ñambi ak ay yams si ñi nga xam ne ñoo nekk Afrique ak def li nga xam ne moom la ñuy wax koor boo ooree doo génnee insuline boo lekkee li nga xam ne mooy graisse doo génnee insuline boo lekkee li nga xam ne mooy protéine di nga génnee insuline waaye du bari kon ku bugg a bàyyi jabet wala jabet bàyyi la loolu ngay def am keneen ku laajte mu ne ndax nen lekk nen bur bu set baax na ah kañ def naa si benn vidéo sax di leen wish happy Easter lekk nen dañ waxoon ne lekk nen baaxul ndig recherche ne àddina di gën a yokkoo rek ngay gën di xam yenn yu bari di gën di jàng yaram yi ndig booy xool lépp luñ ñu jàngal si jabet ak luñ jàngal maladie si jabet dafa utee ak man li ma gëm ak ñeneen ñi nga xam ne niroo nañoo man si xalaatin faj liñ gëm di ki am jabet dañ lay jox insuline waaye insuline mooy yàq indi tafaax kon léegi nag gis nañ ne loolu jafe-jafe la kon te nen li si gën a am solo sax mooy lañ daan yaakaar ne dafa bon si nen mooy yóog mooy lu zone li lu nette li nekk si biir ndig lu weex li dafa am li nga xam ne moom la ñuy wax suukar kon soo buggee lekk nen bàyyi si yóog bi te mun nga koo lekk ñetti yoon si bés bi mun nga koo lekk suba soo xëyee te du la indil benn problème lii indil nit ki problème si wàllum cholestérol du graisse gu bari li gën a mun a indil nit problème si wàllu graisse gu bari mooy suukar ndik suukar boo ko lekkee boo ko jëfandikoo rek li nga xam ne insuline bi daf koy jël fàgg ko denc ko mu nekk graisse googu nag mooy dem taq si li nga xam ne mooy deret taq si li nga xam ne mooy xol taq si li nga xam ne mooy xëtër ak res ba nga xam ne di nga am yenn jafe yi nga xam ne ñi daan naan sàngara ñoo ko daan am te loolu yëpp suukar la waaye du graisse gu bari gi ngay lekk wala nen yu bari ngay lekk kon kii laajte loolu war ngaa mën a lekk nen bër bu set. What he asked over there in terms of eggs, can you eat eggs every day? I made a video on eggs telling people, yes, you can eat eggs every day. It's perfectly fine. Used to be, we tell people not to eat the egg yolk. Well, absolutely. The egg yolk is even better. That's where all the nutrition is, as well as the fat. Your egg white has the carbohydrates. So if you were to eat only egg white, you end up consuming more carbohydrate that you don't need, especially for you diabetics. So you are better off eating the eggs plus the egg yolk. So yes, you can eat eggs every day. Before, we told people it was not healthy to eat eggs because we thought it was going to make your cholesterol high. But no, the one thing that is fastest in raising your cholesterol level is sugar, carbs. Because if you don't use it, it's going to turn into fat and then stored. When it's stored, where is it stored? Around your gut, around your heart, around your liver. And that's what causes fatty liver disease, because we all see what is happening with non-alcoholic fatty liver disease, which used to only happen to alcoholics. So even my patients that have fatty liver disease, I don't give them any medication. All I give them is food. That's why I say you are what you eat. Food is medicine. If you use food as medicine, then you would not need medicine. So thank you, Yuka. And if there's more questions in regards to that, thank you.
Real quick, Jay, Dr. Jay, can you please touch on, I think you mentioned something about 9 months, that if you want to reverse your diabetes, you probably want to stick to these diets or recommendation that you're giving in at least for 9 months. So can you touch on that? Because it seems like it's for most people, maybe if they at least know that there's like an end in sight, that they can actually reverse their diabetes within a certain period of time. And so they're able to at least sacrifice some of the good food that they want to eat for the long-term health benefits in their lives. So if you can just touch on that more.
Sure, surely. Thank you. That's a great question, because when you know you're doing something and there's no end to it, it's very difficult for people to even look at the light at the end of the tunnel. But if you want to reverse diabetes, well, definitely there's light at the end of the tunnel. The reason we said about 6 to 9 months, because remember, how do we determine whether your diabetes is controlled or not? We usually check your hemoglobin A1c. And what is hemoglobin A1c? Hemoglobin A1c is the sugar that is attached to your hemoglobin in your blood, the percentage of sugar that is attached to your hemoglobin in your blood. And we check that every 3 months. Why do we check it every 3 months? Because that blood cell, our blood cell, lasts about 3 to 4 months, and they will die and rejuvenate itself again. So if you have blood sugar that is high and the glucose is attached to your hemoglobin and is running around in your bloodstream, it will still be attached in that bloodstream for at least about 3 months. So for us to check to see if your blood sugar is better, it is not done day to day. Yes, we can monitor you day to day to see if you're being compliant with your diet or with your medications. But for us to be really effective, because when you wake up, your blood sugar is high. In the evening, if you're not diabetic, your blood sugar is low. Because remember, God knows what he did when he made us. Because in the evening, you're supposed to get ready to go to sleep. So you don't need all that energy. You would not need all that sugar. You would not need all that insulin. So both of those will go down. So when you try to test somebody to see if their blood sugar is high and you check it in the morning, it can give you a false number because their blood sugar is supposed to be high anyway. You check it during the day, they've already eaten, their blood sugar is going to be high anyway. So it will give you a fake reading. So the perfect one that tells you whether this person is controlled or not, or cured or not, is the hemoglobin A1c. So if you check their hemoglobin A1c in 3 months, remember, the hemoglobin lasts from 3 to 4 months. So most likely there will be still some cells, some blood that is lingering with sugar attached to it. So that's why we say from 6 months to 9 months. But these are people that are going to be very compliant with the diet regimen, and they should be also followed by someone that knows what they're doing, and that person can help them. And I usually tell people to make a diary. What was your blood sugar? What did you eat yesterday? Write it down. When you come into the office, you bring it with you, and then I look at it and I will take what is perfect for you to continue and what is perfect for you to not continue. And when you do that, after 3 months, you check their sugar, usually their hemoglobin A1c will drop. I had a guy, his hemoglobin A1c was, I think, about 10. When he came back, he was very compliant. 3 months, his hemoglobin A1c was 6 point something. And now he cannot believe that he's not taking any medications, and his hemoglobin A1c is less than 5.3. So he's no longer a diabetic, or we have reversed his diabetes, or he no longer have hypoglycemia, but he has to still continue to come, and we'll check his hemoglobin A1c every 3 months just to make sure he is being compliant. And this person now would have a different diet, meaning they are not going to be on the strict non-carbohydrate diet. They would not be on their GPS. They may be on their GPS ×1, meaning you can have GPS once a day or you can have GPS once a week. So that person, after being diabetic and have the consequences, knowing what the consequences are with family history of diabetes, now he's living without it. He knows exactly what to do. And with the guidance and support, he will continue to be not diabetic. So sànq li kooku laajte mooy ne ki nga xam ne dafa am feebari suukar te ma waxoon sànq ne borom mun nañ koo delloo ginnaaw ba du amatu feebari suukar si diggante juróom-benn weer ba juróom-ñeenti weer. lu tax ñu wax loolu mooy ne boo lañ bàyyee xel biñ commencé dañ ne woon suukar niñ koy seetee ndax baax na wala baaxul wala éeg na wala éegul mooy dafa am lu ñuy wax hemoglobin A1c. nit tey boo tegee nit ki suukaram si suba si dafay yéeg, su ngoon dafay wàcc, waaye si bëccëg mun naa yéeg ndig lekk na. kon kooku boo ko seetalee suukaram noonu rek ndax mu or nga seet ko doo xam ndax suukaram baax na wala baaxul, wala tolluwaay gi baax na wala baaxul. ni nga koy xamee rek mooy li nga xam ne mooy deret bi ngay seet. lu tax mooy ne suukar su baree dafay dal di takk si deret, bu taxee si deret jooju dafay tàmbaambaalu si yaram bem am ñetti weer ba ñeenti weer balaa deret ji di dee beneen dekkiwaat mun a continuer dund léegi nag bu deret jim taxoon deeyee moom suukar si day dal di dem léegi nag moo tax ñu ne diggante juróom-benn weer ba juróom-ñeenti weer mun nañoo xam ndax kii dafay bàyyi lekk bi bu ko bàyyee partout defatu ko loolu moo koy dimbale ba nga xam ne dina mun a delloo ginnaaw si feebari jabetam kon doom aadama bi buñ testé deretam ñetti weer yi dina am benn weer boo xam ne dañ ne woon ñett ak ba ñeenti weer si la deret ji di faatu waaye nag kon deret ji am na si yoo xam ne ba léegi mu ngi tàmbaambalu te suukar taq si moo tax ñu ne la juróom-benn weer ba juróom-ñeenti weer waaye kii mooy ki nga xam ne lépp luñ tere daf ko daal di bàyyi lépp luñ ko digal mu topp ko kon su boobaa kii am na chance pour dellu ginnaaw bañ a nekk jabet waaye même loolu bu boobu weesoo ba nga xam ne kii kat deretam baax na léegi nekkatul jabet bu boobaa ñetti weer yu nekk war nañoo seet hémoglobine A1c am ndax mu ngi méngoog li nga xam ne moom la ñuy wax amoo jabet mooy bi nga xam ne manqué na juróomi point yu tegal ñett kon nit ki bu xamee rek ne am na temps yoo xam ne lañ ko war a traité pour si lekkam pour mu mun a ñàkk am jabet kon su boobaa dina yomb pour borom méngale dundam ak loolu bu demee nag ba wér boobaa dinañ ko jox yeneen fànn yoo xam ne moom la war a lekkee ba nga xam ne loolu muy jàngoro jabet du dal di dellu si waat xam naa si kanam di taa bi moo ñu ko may ak liggéey bi waaye liñ bëgg mooy ne ñu fexe ñu def benn plateforme boo xam ne nit ñi dañuy enregistré maanaam dañuy registré pour dugg si biiram bu boobaa dinañ leen mun di traité même buñ nekkutee suñuy malade si biir États-Unis waaye buñ nekkee biir bitim réew biir Afrique. What I just said there was just basically translating, but I added to as well. For those of you that are not my patients that will be interested later on, I don't really have time. I wish I was cloned or have Juka and Ole to be the doctors as well, so they can help me, because my intention is to create a platform where people will register and they can come in and get health and wellness information, or if they want to reverse their diabetes or high blood pressure, things that they can do, and it will be customized towards each individual because we are all created a little bit differently with different genes. Thank you.
Somebody has a quick question, I think. But if we were doctors, we couldn't help you with your technical issues. So take that.
Yes, I'll take that with. Thank you. I really appreciate you.
The person with the correction, let me see, maybe they put the correction on the chat. Yeah, they didn't say, I think it's Beneta, you can go ahead and ask. Or who is it?
Oh, hi, Juka. No, that's not me. I was about to leave for work.
Oh, okay.
I just don't want to go. It's so interesting. Thank you.
Yeah. Thank you. Mm-hmm.
Hi, Dr. J.
Hi.
I just wanted to add to what Ole has asked about people who are diabetic. I have a husband. My husband has been diabetic for like decades, and he has been taking anti-hypoglycemic medication. He's trying to change his lifestyle to change the diabetic. So he wants to know how, or what would you advise him to do with the medication that he has been taking, if he has to like abruptly take it, get off the medicine, or we need to taper off, or what would you say for people like him who are taking hypoglycemic medication, anti-hypoglycemic medication?
If I may, can I reiterate the question so that way I can clarify? I'm not sure if I heard you clearly. You said that your husband is diabetic, and then you wanting to know what he can do to reverse the disease, right?
Yes, he has been diabetic for like years, but he is on anti-hypoglycemic medication. So he wants to know what he needs to do to stop the medication, I mean, would you advise him to like stop the medication, or would you advise him to like take it until he meets his goal?
Thank you for that question. So there's a lot of technical issues that happens with trying to reverse someone that is diabetic and already on medications, especially if they've been diabetic for a long time. That means they would need a close monitoring from their PCP that is willing to help them go through it, or they can get in touch with me and we can have a discussion, because it needs me to ask a lot of questions: where their blood sugar is, what was their last hemoglobin A1c, how long have they had this problem, what are the other complications that have been going on with this person. That's one step. But yes, the person that is diabetic, that is on medication, what I usually do is that I usually leave them on their medicine. Okay, I'll give them real specific instructions as what to do when the blood sugar is 100, what to do when the blood sugar is 120, 150. So if they're on insulin and they're going to be on the strict diet, I would usually have them come back or call me back within 2 days. We can do televisits where I would know they will write down their blood sugar level. If the blood sugar is low, I need to know immediately, because that person may have to decrease their insulin shots, or they may even have to eliminate the insulin totally. Okay. And there are certain medications like metformin. Metformin does not affect the insulin or the blood sugar as glyburide or glimepiride or insulin. These are different medications, and they all work differently. Some medicines like metformin, all it does, it blocks the absorption of the carbohydrates into your system, so your blood sugar goes up. So it prevents your blood sugar from going up in that manner. But glimepiride and glyburide, what they do, they almost mimic insulin. So the medications that mimic insulin, you have to be very careful when you're fasting or when you're on a strict diet, because then those will lower your blood sugar at a level that you may not want. So it will need close monitoring. So my advice to that person is to get in touch with their PCP, or if they're in Africa, they may try to get in touch with me as well. And I'll be more than happy to talk to anyone that can DM me. Juka doesn't think I know what DM is, but I do know now. So they can DM me and I'll be more than happy to help out. Thank you.
Thank you.
Okay, I think that was it, Dr. J.
Juka, I have a question, sorry.
Sure.
Waaw docteur J, man sama question olof laa koy lakk moo gën a leer sama bopp bi. Léegi li ma bëggoon laaj ci mooy, bu fekkee ni you have a patient that follow all your guidance, mu bàyyi lépp lu nga xam ni suukar la, ceeb la, whatever li nga xam ni daf koy indil suukar. Léegi bu suivre sa diet pendant 3 mois wala 6 mois, comme nu nga ko waxee 9 months, diabète bi mun na dem. Mais su kooku su période boobu passé, est-ce que mun na dellu si waat di lekk encore comme régime bi mu daan lekkee bu fekkee ni reverse na diabète bi, wala dafay am special diet boo xam ne moom lay follow pour que mu mun a éradiquer diabétique si système am? Thank you.
Thank you, Hadi. Thank you for that question. And what Hadi asked there is for someone that was diabetic and they went ahead and followed the strict regimen, and now they are no longer diabetic, or they've reversed the disease or reversed the hypoglycemia. What should that person do? Are they going to continue on the lifestyle that they had before, or what are they going to do to maintain the healthy lifestyle that they have adjusted to now? So if you know how you got here, when you want to go back, you just follow those footsteps, right? Now, if you want to come back here again, you follow the exact footsteps, you're going to come to my house. So if you want to go to Gambia or Senegal, you knew you took a flight to Washington to Dakar, and you want to come back to Dakar, Texas, you're going to take a flight back to Washington to Dallas. Now, if you take that footstep again, you're going to find yourself in Dakar, right? Simple analogy. So if you already diabetic and you know how you got here, we already told you how you got here. Now, the goal is once you get to Dakar and you want to stay in Dakar, then you don't take a flight back to America. So how do you maintain to not taking a flight back to America is when it is important for you to continue your follow-up care, your follow-up maintenance. That's why I thought maybe I should definitely create this platform so people can register and log in. And once they're controlled, if they have questions, they can continue to watch. Once you do this for about 6 to 9 months, it almost becomes a habit because practice makes perfect. When you practice something for 6 good months, 9 good months, it becomes your nature. When you even eat something that is high in sugar, you're not going to be liking it. You will get sick. When I eat anything sweet, I get nauseated. So for that person, they've adjusted their life. They've changed their lifestyle. Now they're not diabetic. We will give them strict instructions on things that they should look out for. They will be educated. They will have enough knowledge to be able to manage themselves. Yes, I would be broke as a doctor because I would not have a lot of patients for the rest of my life, but I would rather have people alive and hanging out with me than most of my friends dead, like my uncle now. So I would love for people to reverse what they have and just maintain what they need. And for you to do that, you have to have the correct information, the education. It's the key to knowledge is just education. So if you're educated enough and you know how to care for yourself, then you would know, okay, this week I had a party, I had to have a glass of wine for my Christian friends, or I had some steak and I had some mashed potatoes, and Sanya is really good at cheesecake and her husband cooked me some cheesecake and she gave me cheesecake every time that I went to work. So, but I will eat that cheesecake for maybe a month because I'll just take a little scoop and that's it. I just want a taste of it. So if you want something and you're not diabetic, you reverse your disease. You can still enjoy the foods that you love, but in moderation. Whatever you do too much of, it becomes a problem. 80% of the time is all we require for you to be perfect. So that question was important. So Khady lim laajte foofu mooy ne naka la ñuy fexee ba ki nga xam ne dem na ba dellu ginnaaw nekkatu diabetic kooku naka lay def ba fagaru ba nga xam ne lii nga xam ne moo nekkoon jafe-jafe muy diabetes du dellu si waat. Li ma ko tontu si olof mooy ne si angale mooy ne boo buggee dem Dakar nga jógee Dallas nga dem Washington dugg avion dem Dakar boo buggee dellu si waat Dallas da ngay duggaat avion dem Washington dellu si Dallas léegi boo xasee ba egg Washington dem Dakar te buggatuloo egg si Dallas da ngay bañ a dugg avion bu lay indi Dallas ndax du kon ki nga xam ne dafa amoon jabet ba wér kooku ni muy fexee ba éviter jabet dellu si waat fam jaaroon ba am ko moom lay éviter moo tax ñu bugg a liggéey benn liggéey boo xam ne zaari nit ñooñu même buñ demee ba nga xam ne amatuñ jabet dinañ mun a bokk di continuer di laajte ay ndimbal di laajte question buñ gisee lu leen jaaxal si seen yaram dinañ ko mun a laajte ndig li si am solo rek mooy nit ki am xam-xam boo xam ne moom si boppam dina mun a toppatoo boppam ba du soxla docteur dëgg la xëy na duma am xaalis waaye bu boobaa am xaalis te amuloo ñoo ko bokkal amul sens li comme li ma wax sànq suma nijaay boobu faatu man ma toogoon moo ma gënal ma am alal kon ma am ay mbokk yoo xam ne dañ nekk ak man di dund moo ma gënal ñu nekk ak man di am feebari jafe-jafe jabet wala ñuy faatu kon doomu aadama li gën a am solo pour faj mooy ki war a faju moom si boppam dafa war a xam li ko jot lan la naka la ko jotee naka lay fexee ba faj ko bu ko fajee naka lay fexee ba du dellu ginnaaw si loolu nga xam ne mooy feebar bi kon loolu la ñuy wax empowerment te xam-xam du dul dara lu dul jàng ak yokkandiku si li fa nga toll woon jërëjëf Sister Khady.
Thank you, Doctor.
Okay.
I know there's some people that came in late.
Mm-hmm.
I don't know if they have any questions before we check out. Juka.
Yeah, that's what I was going to say. I think Sheikh Fall and somebody else. New England, and then something I may have been like the moon quite like table and you teach program.
maa ngi jégalu man la may sa docteur Dieng maa ngi lay nuyu baax a baax di la jaal sa nijaay boobu xaw ma nag segam jot na parce que dama yéex a ñëw question boobu segam posé nañ ko parce que bon ni ma dégg ngay wax ci kii yu bari diabète bi en fait lu ci bari ci lekk bi lay jógee sunu façon ni ñuy lekkee yu demee noonu mais bu ñu jëlee réew yu mel ni sunu réew nga xam ni bon xëy na ceeb bi moo gën a yomb ceeb bi moo gën a yomb et puis moo gën a yomb defar aussi par rapport ak temps bi nit yi ban ci lan leneen la nu mën a appuyer wu ba mën a dund mais lekk parce que tamit damay gis ni yu bari da ngay dindi fruit ci lekk bi nit yi war a lekk bu ñu génnee ceeb bi bu ñu génnee mburu mi bon finalement nit yi dootuñu xam lan la nu mën a lekk réellement daal cere sax dañ koy dindi ci kii bi nee nga yooyu yëpp dafa am sucre donc lan la nit yi di war a mën a lekk li nga xam dafa yomb mais xaj ci seen poche aussi merci beaucoup.
waaw jërëjëf Maysa jukka ule kooku mbay la sant moo tax muy jooy bañ ko aayee ceeb ak mburoog cere mbay la sant moo tax so boo bàyyee xel Maysa sànq xam naa boobu dugg seeguloo mais li ñu waxoon mooy ne lii faju la lekkam faj la maanaam nekkul lekk goo xam ne danga koy lekk sa giiri dund lekkum faj la mooy ne dangay bàyyi lépp loo xam ne dafay nekk suukar te liñ si àpp mooy juróom-benni weer ba juróom-ñeenti weer bu yàggee ba yàgg at kon ki nga xam ne dafa yàkkamti pour togg li nga xam ne moo gën a bari kooku bu xoolee temps boo xam ne daf koy perte si docteur daf koy perte si hôpital daf koy perte si bët yu lëndëm daf koy perte si yoom daf koy perte si tànk yuñ dagg yaakaar naa dina gën a yomb pour mu xoolkat ne am na ay légumes yoo xam ne mun na koo jiyal boppam si kiram surtout ma laa ñu nekk Afrique wala mun na koo jënd defaral ko boppam lekk ko ñun dañ tàmm rek di lekk ceeb ak mburu waaye nekkul ne foofu la lekk yem léegi nag ki nga xam ne nag moom dafa amagul jabet te buggut a bañ a am jabet kooku waxuñ ne du lekk yi waaye comme ñun nuñ koy lekkee nga xam ne da ngay taal boli jël tuuti légume jël tuuti ndalaw def si genn wàll lekk wala 90% yi lekk bi yëpp maanaam boo ko xaajoon téeméeri xaaj juróom-ñeenti xaaj yi yëpp dafay doon ceeb wala dafay doon mburu loolu lañ wax ne mun naa bañ a nekk nit doom aadama dafay yar boppam si lekk yar boppam si biiram ni ngay yaree sa bopp si biir mooy nga tàmmal sa bopp loo xam ne du la indil loraange même boo buggee lekk ceeb da nga war a fexe sa assiette sa bool bi ngay lekk nga xaaj ko ñeenti xaaj bi benn xaaj rek mooy nekk ceeb beneen xaaj bi légume la war a nekk beneen xaaj bi ndawal tey boo waxoon ne ki nga xam ne dafa am jabet naka lay dundee Afrique yomb na chou-fleur muy cauliflower am na Afrique li nga xam ne mooy salade am na Afrique li nga xam ne mooy bisaab am na Afrique li nga xam ne mooy nebedaay am na Afrique li nga xam ne mooy supame muy cabbage am na Afrique te yooyu yëpp am na noo ko mun a defaree ba nga xam ne di nga ko lekk te doo soxla li nga xam ne mooy ceeb si diggante at wi wala juróom-ñeenti weer yi pour nga wér boo xasee ba wér na nga fexe boo paree pour lekk nga taaj sa booli salade lekk ba nga xam ne sa salade jeex na nga jël sa ndawal ak sa ceeb lekk bu boobaa di nga gis ne li ngay lekk si ceeb du bari di nga dal di suur kon li nga doon namm si ceeb di nga ko mën a lekk te du la sonal kon loolu yëpp nit ki mooy xool lan moo gën a am solo si man benn ma lekk li ma war a lekk yëpp si téeméeri at ma lekk ko si fukki at wala ma jël li ma war a lekk si téeméeri at ma xaaj ko ndax mu mun a dem ñaari téeméeri at. What this guy asked earlier is very important because for those of you like Sanya in the US, it's not hard for us to go to the store and find vegetables, any type of vegetable, any type of year, you're going to get it. But for those in Africa, it's hard to get some of the vegetables that you can use to make the substitute that you may have. But I think those are all excuses. When one wants to change their lifestyle and sees the benefit of change, you would do whatever it takes to do it. And one thing that can help people do that is when you look at, if you think it's fast to boil rice and eat it with fish, but you think it's going to take you a while, which is even faster to cook these food substitutes. It takes me about 5 minutes to make cauliflower rice. It takes you about an hour to make regular rice. So for the 9 months, you can sacrifice when you know that you are going to avoid yourself from getting an amputation, going blind, having a heart attack, getting a stroke, because then you are going to really spend a lot of time with your doctor, going to your doctor's offices. Almost every day you have an appointment. God forbid if you have dialysis, because you know with diabetes, you're going to end up with kidney failure. You go to dialysis 3 times a week. And those of you that are in Africa do not have the luxury of dialysis. We've lost a friend recently. A friend of mine's friend passed away from dialysis, from kidney disease because of lack of dialysis. So do we choose to say this is much easier for us to do, or do we choose to do what is right for us and we can live without the disease for the rest of our life? So if you want to do, that's what I say. What is fast food? Fast food is nothing but faster to death. Yes, it will get you faster. It's cheaper for your pocket, but it's not cheaper in the long run, and it's not going to slow down your death or even your quality of life. So it's all about what do you prioritize? It's all about priority. If a man wants to change, they can change regardless of how hard it is. The easier is not always the best, and it's not that difficult.
So,
thank you.
Amadou Cissé, dégg nga di docteur Dieye wax. Yaa ngi commencé lekk pour peut-être pour Amadou Cissé moo doon laajte.
Okay, Dr. J, so to add to Mr. Mbai's question, and I'm sure because he's Mbayan, so of course we have to try and help them out because I'm sure they're going to be crying. So for somebody that's living in Africa, and I think now it makes more sense because it's like, this is more like a temporary journey, like I guess 9 months, the worst will be like 1 year to sacrifice and eat these foods to be healthy in the long run. But in Africa, like, so let's say instead of rice, because we all know that's kind of like the stable food. And for most people also, like from a financial perspective, we have to consider that. So what would you recommend that they eat during this time? Are you saying, they said cauliflower or something? If you could just touch on that, like what are some of the key substitutes that they can eat instead of the rice?
So are you not liking the cauliflower? Is that the problem? There is cauliflower in Africa. So cauliflower is one substitute. Cabbage is one substitute. And even for my, so cauliflower is one substitute. Cabbage is one substitute. Like when you talk about almonds, so almond flour, for those my Nigerian friends and Ghanaian friends or African friends that like fufu, you can take regular oatmeal and make it into a flour, and then take recently, like yesterday, I have a patient who is from Nigeria, okay, and he's an older guy. I think he's in his 70s with his wife. Both of them are diabetic, and they left their initial doctor and came to me because the doctor discharged them because their blood sugar was continuously being high, and he did not want that to go against his numbers, because we are also rated based on the outcome of our patients. So when he came, I questioned them about what they were eating, what their diet was like. So they knew rice was not good, but they thought plantain flour or yam flour or cassava flour was good, or gari. So this is what they were making into fufu. So when they came, their hemoglobin A1c was about 14 for both of them, and they're very little, okay? So what I did with these people, I tried to reverse their disease process. So what I did was I told them to buy whole oatmeal, make it into a powder form, and also buy coconut powder. There is coconut powder. So that's why Africans need to be more inventors in terms of creating new things for themselves. So they bought coconut flour. So I told them, take 2 cups of coconut flour, mix it with 2 cups of oatmeal, and make your fufu. So the glycemic index in that fufu is going to be totally different from the glycemic index on that on plantain or rice or the regular fufu from yams. So with this person, we started from 14. And as of yesterday, when they came back, both of them, their hemoglobin A1c was 6.3. I remember clearly because we had this discussion. So now when they saw the video, they were like, they want to reverse their diabetes. I said, okay, so now you have a choice. Do you want to continue a hemoglobin A1c of this and be on metformin? Because metformin has a lot of side effects in terms of even cancer or kidney failure. Or do you want to skip eating fufu for 6 months and then we get you off of this? And then once you get off of you reverse your hypoglycemia, now you can eat your fufu, but it will be maybe twice a week or 3 times a week. So you just choose 1 carbohydrate a day and make it your meal. So for those that are in Africa, you cannot just go straight up to, if you are at a 14 or you are at a 10, it'll be very difficult. I'm very realistic. I don't think everybody's going to just get up from one day and going from hemoglobin A1c of 14 to hemoglobin A1c of 5. So my goal is to gradually decrease your blood sugar level by allowing to eat findi, by allowing you to eat cherry, okay? And reducing all the juices, all the processed food, eliminate that for at least the first 3 months. And then the next 3 months, we're going to say, okay, now you're going to have salads, and then you're going to do what's called intermittent fasting. Don't eat in the morning. And we would work through that through a journey of telling you exactly what to do. So it's a process. So that's why you would need someone that has the experience, the knowledge to guide you and put you in the right direction to the point where you can obtain your goal and still be enjoying yourself and not feel like you're being punished. Thank you, Ole. Did I say that in Wolof?
No, not yet.
Okay. So lima wax fofu sank moy ne Ulay dafa laajte naka la ki nga xamne dafa nek Africa. Dafa nek Africa buga soppali li nga xamne moy jabetam delo ko ginnaw. Nit dafa jafe pour nga dundé Africa li mbayen bi laajte sank momit mom la delu ci war rek. Dafa jafe pour ki nek Africa jog rek bayyi ciép bayyi lepp lu muy dundé naka lay dundé du mëna yey xop rek bor bu set nik sama mam mo daan wax ne du xar mom kenn du ko jox xop mu yey ndawal lay lek. Okay, so koku do jog ben bes rek nga bayyi loko lepp da ngay commencer ci lu ñuy wax processed food moy ki nga xamne mu ngi na baked beans li nga xamne moy jus mu bayyi ko li nga xamne moy ay Coca-Cola ay soda ay Fanta ay Vimto mu bayyi ko lolu yomb na pour bayyi bu lolu wesso nga ne ko fim nek pour mu dundé ciép bu weex bi da fay dundé ciép bu marron mais ben yoon rek lay lek li nga xamne moy yegal sukaram bor bu set du lek ciép dina ko wecc lélé mu lek find lélé mu lek ciéré lélé mu lek ciép way ben yoon rek la koy lek yeneen ñaari ci suba mu lek nen wala su ngoon mu lek salade nga def ak mom nonu be nga xamne sukaram ci fam tollu won genn walé xaj bi yeb dem na koku wañi lo nga ko lu bari pour mu wañi gis ne amna njiriñ pour nga jangal ko num wara def be wañeku dina yomb bu boba koku mun nga joge muy lek ñetti yoon di dem di lek ñaar yoon suba si mu bañ sé lek ngay naxante mom diko wan yan lek la wara lek diko remplacer li nga xamne moy lekam ma jox ko exemple si ben malade bo xamne ay Nigérian lañ jëkëra jabar am nañ lu ëpp juroom ñaar fukki at bi ñuy ñëw si man seen hemoglobin A1c demon na be fukk ak ñent waaye démb bi ma la ñuy seet seen hémoglobine A1c manqué na juróom benn ak lu tegal li ma leen njëkk a def loo mooy ne ñoom dañ bëggoon fufu dañuy lekk fufu bër bu set te ñoom dañ yaakaaroon ne xamoon nañ ne ceeb baaxul waaye yaakaaroon nañ ne fufu boo xam ne dafa jógee si gari wala dafa jógee si ñambi wala dafa jógee si plantain baax na waaye xamuñ ne fufu boobu dafay loraate soo li ma leen def loo mooy dama leen jëndloo puudari koko ak li nga xam ne mooy puudari oatmeal ñu wol ko boolante ñaari kopi koko ak ñaari kopi oatmeal def ko muy fufu ñu koy dundee léegi même ki nga xam ne sax dafa bëgg mburu mun naa jël li nga xam ne mooy koko defar ko oatmeal di ko lekk am na yeneen lekk yoo xam ne lu mel ni pasta jàng naa nu ñuy defaree pasta si jógee si nen ak si li nga xam ne mooy koko pour ñi nga xam ne bëgg nañoo dund si anam yooyu te bañ a lekk yenn lekk yi yooyu yëpp dinaa ko jéem a won nit ñi naka lañ koy defaree waaye Afrique foog ñu jéem a xool naka la ñuy remplacer ceeb suñ buggee ñàkk am jabet waaye buñ amutee jabet it waruñoo dundee ceeb bër bu set dañ ko war di jëllale tey buñ lekkee ceeb suba ñu lekk findi gannaaw suba ñu lekk cere waaye nañ ko lekk rek benn yoon si journée bi li si ëpp si seen lekk na nekk ay lëjum te lëjum bari na Afrique neex na faa ji jafewul pour def kenn ku nekk am nga pàkk sa kër war nga faa mun a ji ay lëjum yoo xam ne di nga ko mun a jëriñoo nga xam ne sax mooy gën a yomb nga dem si marché bi di ko jënd kon loolu yëpp dafa des si tolluwaay nit ki lan la bugg a def ba nga xam ne dina aar boppam ak ay mbokkam jërë ngeen jëf.
docteur Dieye xam naa man dinaa leen sonalaat tuuti dama yéex a ñëw maa ngi jégalu bu baax a baax mais dama amaat beneen question est-ce que le fait que suukar bi bon ngay def ba suukar bi wàññeeku est-ce que loolu dafa faj diabète bi wala ou et puis nit ki nga xam ne dafay def sport bu bari di daw di kii yu demee noonu même bu dee taux sucre bari woon na est-ce que le fait que muy def sport bu bari dafay wàññi suukar bi et que est-ce que kooku mën na compenser di lekkaat normalement comme ni mu doon lekkee avant ou pas mais la question la plus question bi ma gën a bëgg a xam daal mooy est-ce que diabète en fait dinañ ci wér wala est-ce que boo dindee suukar bi rek ci sa yaram diabète bi wér na ou pas est-ce que comprendre nga suma question
diabète ñaari problème la suukar su bari ak insuline bu bari waaw comprendre naa sa question diabète ñaari problème la suukar su bari ak insuline bu bari sport mooy daw entraînement amul dara pour def ak wàññeeku amul dara pour def ak sa insuline bu bari dinaa faram fàcce sport li muy def mooy ne lekk gi nga lekk muy suukar lu munti def doole bi mu war a yokk sa yaram moom lay jël pour nga utiliser ko ba nga xam ne du mun a dencu dem nekk li nga xam ne mooy graisse kon benn fànn sport dina wàññi yaram waaye du faj li nga xam ne mooy diabète lu tax du faj diabète mooy ne sport li muy wàññee suukar rek mooy ne boo waroon na bu doon ne defuloo sport nga lekk téeméeri suukar booy def sport xëj na dina wàññi genn wàll gi des sa yaram boo deful sport dina wàññi ñetti xaaj yi dafay des sa yaram benn xaaj bi rek lay bàyyi ok si wàllum insuline ndi ki am diabète type 2 insulin resistance mooy problème am kii def sport wàññul lenn si insuline am déedéet boo koy xool sax dafay yokk si li nga xam ne mooy insuline because booy def sport da ngay génnee benn hormone bu ñuy wax cortisone dafay tax nga gën a xiif dafay tax nga gën a am kàttan waaye dafay yokk sa suukar te bu cortisone génnee insuline dafay dal di génn ok kon sport benn rek la mun a defal si faj mooy ne dina dimbale sa cër ba nga xam ne doo gaaw a làgge du gànk dina dimbale li nga xam ne moom nga waroon a denc mu doon graisse dina ko wàññi ba nga xam ne du doon graisse waaye bu dee da nga dem def sport boo jógee si sport bi nga lekk sa booli cere wala sa booli ceeb la nga manqué woon sa sport ba yëpp remplacer nga ko après sport bi kon kooku mun naa dimbale boppam pour wàññi suukaram waaye munta faj boppam si jabet te kooku bu yàggee sax moom mun naa gën a am yeneen problème mun naa dem sport rek daanu faatu ñu ne lu xew te fekk inflammation bi nga xam ne moom la suukar su insuline bu bari bi di créer kooku loolu moo koy lor tey si misaal soo jëlee ñaari nit nga jël ma man jël jukka jukka dafa bëgg a yokk yaramam man dama bëgg a wàññi suma yaram ñun ñaar ñëpp mun nga ñoo jox garab bi sport pour ñu exercise jukka dina si jógee am yaram man dinaa si jógee ñàkk yaram lan moo ñu utale ñun ñaar du si sport bi ñuy def de li ñu utale rek mooy li ñuy dundee te bu jukka sporté ba pare lekk dafay yokk yaramam man bu ma sporté ba pare lekkuma damay wàññi suma yaram kon sport amul benn relation ak yaram wu yokk ak yaram wu wàññeeku si anam yooyu kon sport du faj jabet dina wàññi suukar di nekk sa yaram waaye du faj jabet léegi nag sa beneen question bi mooy ne ki nga xam ne dafa bugg a faju est-ce que bu fajoo ba pare mu delluwaat si lam newoon li ma waxoon sànq rek laay delluwaat la nga newoon ba tax nga am li nga am boo si delluwaatee rek dellu fa nga newoon léegi nag boo demee ba xam li nga bugg te nga ne egg fa nga ne li ngay fexe mooy ne nga fexe la nga newoon nga wàññi ko ba tax di nga mun a maintenir fa nga nekk ba bañ see jëlee jafe-jafe kon waaw soo fajoo ba wér nag suñ la jamee paaka nga wér nga jëlaat paaka bi jamaat sa bopp est-ce que da ngay gaañuwaat waaw da ngay gaañuwaat léegi li ngay def da ngay bañ a jël paaka bi di jam sa bopp rek what he just asked is if someone plays sports or someone exercises, would that help you cure your diabetes? I said, no, it would not. The reason being, sports or activity has no relationship with your insulin production because diabetes problem is not sports, it's not lack of activity alone, but it's insulin production. The only thing that can reduce insulin production is not eating or not taking carbohydrates. What sports can do or activity can do, it will keep you mobile. It will, yes, there are some health benefits, but it does not have any relationship with weight gain. Yes, if you exercise, you would have more energy expenditure, meaning you are not going to store as much fat, but it's not going to do anything for your insulin production. If you have two people between me and Juka wants to gain weight and I want to lose weight, I can have the same regimen of exercise and Juka is still going to gain weight and I am going to lose weight. The only difference between Juka and I is not the exercise, but the food we consume. So therefore, sports has no correlation with curing your diabetes or trying to lose weight. It does not make you lose weight. It will keep you mobile. It will keep your joints healthy. It will keep you healthy in another form, but not necessarily decreasing insulin production. The only thing that decreases insulin production is fasting or GPS. Okay, so he asked again, what if you already cured yourself from the hypoglycemia? Does it mean you are no longer going to be diabetic if you go back to doing what you were doing? And my analogy was simple. If you stab yourself with a knife, you get sutures and you healed your stab wound, and you get up the next morning, you stab yourself again. Are you going to puncture yourself again? The answer is yes. So it's simple. So if you do not want to stab yourself, if you don't want to be injured, just don't stab yourself. It doesn't mean you would be on GPS for the rest of your life. No, it just means that you will be GPS maybe every other day, or just maybe fast sometimes, just to maintain your insulin. So you are going to be more insulin sensitive, meaning the little food, the amount of food you eat is not going to determine how much insulin your body produces. So if you eat rice and your body produces this much insulin, that's going to go away. It's not going to stagnate in your bloodstream to create you to have inflammation or to create you to have heart disease or to create you to have insulin resistance. So I hope that was clear, and hopefully Maysa yaakaar naa ne loolu leer na fi mu nekk. Xëy na loolu dina la dimbale pour nga comprendre nit ki bu xasee bi wér war naa mun a éviter waat pour am ko, waaye bu delloo sa la mu newoon fa mu newoon rek lay delluwaat. Thank you.
Okay, merci.
Okay, let's see if we have any more questions. I think that's it. I don't see any more. Unless people have questions they want to ask directly.
All right. Sarah, you have a question? What's your question? Okay, I guess we are good. So thank you all for being here today. This was really great. And I hope you guys enjoyed the program, and we'll try to schedule more at later, maybe soon after the Ramadan. Sania, is Ramadan time for those of you. We are fasting, so fasting is a great help, but I think sometimes it's a hindrance for us, because when we eat at the end of the fast, we always eat more than what is necessary. But I really appreciate you guys coming out here, and please share the video later on. You can share. 𝐓𝐇𝐀𝐍 is recording it, and I think it's on Facebook as well, so people can share it and with your family and friends, because this is a great topic that we need to discuss. Like I said earlier, 1.5 million people die from diabetes a day. That's a day. And today it's unfortunate, my uncle was one of them, especially the 1 in 4 that doesn't even know they have diabetes. So this is something that I'm going to take dearly to my heart, and I'll continue to try to empower you guys and let you know what I know. And I'll do my best to always give you the best information out there, continue to do research. So I just wanted to share something real quick before I go on, in terms of Coca-Cola and people that like to drink soda, and the reason why I always say no soda. My patients will always say, what are we going to drink? No soda. What we're going to drink? No soda. Because 1 can of soda contains about 39 grams of sugar. The regular Coke that we have, the bottle, is about 65 grams of sugar. The big bottles or the big cups that we sell in Texas is about 108 grams of sugar. And remember, I said 20 grams of sugar is about 5 teaspoons. So just imagine drinking 5 Cokes a day. How much sugar are you consuming? And do you guys know the meaning of soda, where soda came from? Soda came from the word sodium. Sodium means salt. In the US, we call soda soda because of sodium. And why do we put so much sodium in soda? It's because it makes that liquid acidic. And that's why it's an acid. If you put it on a battery, you see it bubbling. It's because of the amount of sodium. Just imagine you take this much salt and this much sugar, which is about, you have that much sodium and that much sugar in 1 bottle, and you drink it. Just imagine what's going to happen to your blood sugar and what's going to happen to your blood pressure. And the amount of caffeine it contains and all the other extra chemicals in soda. So you are what you eat, but always remember, food is medicine. We eat to stay alive. we are not alive to eat. So we all have purposes in life. So let's find what our purpose is, and instead of relying on food to fulfill what we are lacking. So if you are going to eat to stay alive, then you must not eat things that are going to destroy you or kill you. So that being said, I hope you guys can share this information and think about it, and think about the consequences that happens with eating the wrong stuff or not being mindful of how you eat. Everything you do, you have to be mindful about what you do, whether it's eating, whether it's living, whether it's doing the right thing. So thank you all. I really appreciate you. Thank you, Juka. Yes, I appreciate you for helping me out through this. Thank you, Ole. Thank you, Mariam. Thank you, Seh. Thank you, Hadi. Thank you, Binet. Thank you, Sania. Thank you, all of you, for coming out today. I really appreciate it. And I hope you guys will take it to heart to share with your families and friends, because that's the only reason why I'm doing what I'm doing. As long as you guys are good, I'm good. Thank you, and God bless. Stay safe.
Thank you.
Merci.
Dr. J, if you want to close the live, and you could end the live on Facebook, and maybe the people here, it just could be something intimate. I don't know if they want to talk about
Yes,
anything.
I'm going to close the live,
So
and
that
then
it'll
maybe...
just be, yeah.
Yeah.
You can talk for like maybe 15 minutes or more. Dr. J, unless Dr. J, you have something to do, close
No,
live.
I'm just going to close the live. So for people that want to be here.
And chat quickly about stuff, I don't know, especially that lady that, I don't know if she's still here too. She talked about her husband and so on. So I think it'll be great to do it.
Yes.
Well, Dr. J.
Yeah, hold on just a second, Hadi. Let me make sure this is
Well, Dr. J.
Yeah, hold on just a second, Hadi. Let me make sure this has any friction yet. Yeah, hold on just a second, Hadi. Let me make sure this has any friction yet. Close down. Life bit of my Indian yam yam is trying to end it, but it's not still on.
Okay, well, I guess maybe we could just end it.
Hang on, let me see.
Okay, well, I guess maybe we could just
hang on, let me see.
Maybe we could
hang on, let me see. See, that's why I don't like technology. Ole's people. Is it gone now?
Yeah, it's not echoing like before, but let me log into Facebook and see. It should be.
I don't see that in this one. Oh, there's something here. I think that's
probably why. Using two devices, Dr. J.
Yeah, I think there was a, that's why it was echoing.
Yeah, yes.
Because that's why it was echoing. That's the crazy screen was still on.
Yeah, is what it is. You need to turn off the other audio.
Yeah, I think you are still live, Dr. J.
Yeah, I'm trying to turn it off on my phone. For some reason, it's not. Hang on.
You may have to do it through the Zoom.
Yeah, maybe. You're right. I just remembered that.
Yeah.
Okay. Are you still on in control?
Yeah, I think so.
Yeah, so if you can get it off there.
Get it over. Okay, so I just hand it over to you. Okay, so you could end it from there.
Stop live streaming. Yep, that's where it was.
Now you know.